Is November 6th, so this is our November monthly meeting for Housing, Health, and Human Services for Manhattan Community Board 4. I am co-chair Maria Ortiz. This is my co-chair Joe.
Restriction?
We don't see him yet, but that's okay. Just so everyone is aware, this meeting is being recorded online and it will live on YouTube forever. If you are new to the meeting and you're not part of the listserv, please sign up so you can get notices about the meetings that we had and see the agenda in advance, including what's in the Dropbox to prepare for any meetings. For attendees who are, not attendees, excuse me, CB4 members who are attending virtually, as you already know, keep your camera on. If anyone's interested in seeing the policy for that, it exists online on the Manhattan Community Board 4 website. The run of show essentially is that after we introduce ourselves, we'll get to the agenda and there is a presentation or a discussion on different topics. Then the discussion goes to committee members and then it'll go to the public and or attendees. And then it comes back to committee members where we discuss if we're writing a letter that goes before full board for a final vote. And just for today, I am going to really advocate that CB4 members, please keep comments brief. And if it's already been said, please don't repeat the same thing, or if you do need to, just keep it short and sweet. Because we have a lot on our agenda today, and you know I start to get antsy after a certain amount of time. So let's begin with going around the room, starting with Katie. And then we'll go on.
We'll skip this Katie, go to this Katie first.
Katie Savage, committee member. Maria Ortiz, co-chair.
Joe Restuccia, co-chair.
Kevin Collins, committee member.
Roberta Barnett, committee member.
Travis Bosch, public member.
Ryan Roman, committee member.
Ian Buckley, committee member.
Brian Sloan, committee member. Matthew Klein, committee member. Pete Diaz, committee member.
And
Line.
Acting Vasquez, CB4 member.
Thank you.
Sure.
Charles Montorio Archer, CB4 committee member.
And
Katie Stokes, without my mouth full.
so I want to first welcome Viren
Yes.
as our ambassador, who's our new committee member. Has come from Chelsea Land Use and joining us. Welcome. Been a board member for quite some time.
Transportation.
I'm sorry, from transportation. I apologize. You're staying in land use. I apologize.
So was there a trade made, like, you know, like a baseball?
There's always a trade made, trust me.
You don't see in 5 years.
So we had other folks wanting to trade also into our committee, but to be aware, ours is one of the largest committees. So be very careful that we don't overload the committee and have problems with quorum and being able to take actions. So we've had a whole discussion back and forth with our chair and our district manager about this. I want to talk about our agenda first, just to tell you why things happen and what's happened here. So we were supposed to be having an update regarding the West 49th Street buildings with all their specific troubles and issues and illegal activity. That has been postponed to December. And one of the issues there was that the community board brokered, why has the owner not met with HCC yet? This is a whole back and forth that went on. And I swear, first thing they said to us is, well, they never got back to us kind of thing. I was like, the idea that the board sends a letter and asks you to do something and then there's a lack of communication. So we repaired that communication link. And the good news is that HCC actually in attendance actually met with the owner last night. And they have sent us an updated email and they're going to be appearing in full at our December meeting of this committee. And a lot of specific details were worked out, at least to track items. Now, we don't know this owner what they're going to produce, but at least we have things that are be very clear and be able to be tracked all the way through. Next item, next item was on our agenda that is now postponed to December is the NYPD access to NYCHA cameras. That's because our council member, Gail Brewer, is not able to be here tonight or her staff to make that presentation, so it's being postponed. That leaves 3 items on our agenda for tonight. The first item is Health and Hospitals, the show van, Street Health Outreach and Wellness, followed by a presentation of by the public service retirees. However, we're going to move that after something that has come onto the agenda, which is we have Chelsea NYCHA tenants about a specific incident that happened at Chelsea NYCHA last week about a relocation that went awry. So we're gonna hear from that first because we have people waiting outside to come in to make that presentation. And then we'll return to the retirees. And the last item will be 420 West 45th Street, which is a proposed middle income project. And they're coming here for an Article 11. And we have that applicant, it's L&M Development, and we're gonna let them know when we're getting closer so they can come on Zoom to present. So let's start out, and I wanna note for timekeeping because of the volume, the second item, we're gonna, item number 1, health and hospitals, it's 6:42. We're gonna try for 30 minutes on this, max 35 minutes, okay? So let's start this off and introduce H&H. And then when I say 30, that's in total, presentation plus everything. I thought you appreciate that too, so we keep it moving ahead. So,
Joe, you've made me a very happy lady.
So let's go, if you can introduce yourselves, who you are, and then we'll talk about the program. Now, I want to mention that our conversation tonight is very much about not the merits of whether or not this program works, but the siting of this program. And that has been the ongoing issue. So let's back up for a moment before they start off.
Excuse me, Laura, do I need to bring Dina over?
She's
there.
here.
She's there, in the middle.
Oh, I didn't even see you. Oh my goodness, it's been a day, okay.
So
Good to see you.
So this committee handled Bridge to Home at our last meeting, the mental health facility slash semi-shelter on West 36th Street between Dyer and 10th. And the big issue we struggled with was, again, no notice, the thing opening up, back and forth with elected officials, and trying to come up with a good, solid discussion about it. We took a position that was sent to the health and hospitals, and our elected officials were deeply involved in this. We have since had our first community advisory board meeting. Maria and I went last week, and there were, who else was there, Maria? Brian Weber, Carl Wilson from council member's office, and there were some people who came who were appointed that it was interesting to find people that were recruited in various ways. So we'll be talking about that. But in the intervening time, the issue about this medical van showed up, and that is there was no notice. We found out about this because there was a permit requested to post the van, a traffic permit on West 36th Street between 9th and Dyer, opposite the Canoe. The Canoe we know has major problems. And so Brian Weber was notified of that through the police precinct. This became a conversation at the community board level, meaning the district manager, the chair, and there's been a back and forth about it. So it's not about very much, is this service good, bad, or whatever, we're gonna hear about it. It's about the siting of the service in a location that has an incredible amount of social services. So Laura, take it away.
Thank you, Joe. So I'm here tonight with Andy Cook and Dina Montez. Andy Cook is going to do the presentation on the show program. I do want to say very quickly, as a sort of to tee it up, the show program was a COVID era program that we created when we were running a massive mobile testing and vaccination program that went all throughout the city. It is modeled on the same concept, which is that it was difficult for people to come to hospitals and doctors' offices. So the best way to do prevention and testing and vaccination was to bring it to their neighborhoods, park a mobile unit throughout the day, rotate it through the city, remove it every night, it goes back to a parking lot, and then do it the next day. So the show vans were specifically looking to connect street homeless folks with medical services, understanding that the disconnect would be even larger among that population. And so the show vote program has continued to run since COVID. It's the only mobile program left from that particular chapter of our response to the pandemic. It rotates all throughout the city, and the process is the same throughout the city. And Andy in his presentation can talk about how we determine where to deploy the vans. But if you go online, if you just type in NYC Health and Hospitals show van, you can see the entire schedule right now. We publish it every week. We'll talk about why it's in these areas and sort of what the concept is. So, the way that we've approached it here, folks took us to the Canoe and to Bella Abzug Park many times in the conversations leading up to Bridge to Home. And as folks may have kind of learned about health and hospitals at this point, if you point us to a problem, we will try to find a solution for it. So one of the things we considered was how the show program could help with folks who were not necessarily appropriate for Bridge to Home, are not necessarily going to be a part of other programs, but maybe this will be kind of an apparatus that we can leverage, being a larger healthcare system, to help folks who are in those areas. I would say additionally, one of the commitments we've made in opening Bridge to Home was that our services would not sort of stop at the door, that we would try to be kind of a positive force for reducing some of the quality of life issues and other types of concerns that were identified over the summer to us. And so SHOW is also trying to kind of help support that and help keep us, to our word about being able to provide more resources than just the Bridge to Home site itself. So on that note, Andy, I'm going to kick it over to you for the presentation.
Sure. Thank you, Laura. Hi, everyone. Andy Cook. I'm the Administrative Director for the SHOW program. I guess I'll just start off. Apologies that you all didn't know about the permit and all of that before it went in. We did our normal process, but here we are. We can talk about it. And honestly, would love feedback from the community on where we can be most effective. I will share my screen to do the presentation. Can everybody see that? Sorry, I know I got a toddler in the background. Hopefully he will be minimally involved. Okay, let's this. Okay, so the SHOW program, as Laura said, it started during COVID, and it really started and continued to take hold as we also continued efforts as a city to address street homelessness and the health and housing and social needs of individuals, of New Yorkers who are experiencing homelessness and particularly street homelessness. So really what we're all about is bringing services to where people are. We're going to where we have, like the data we use, for example, is the opioid overdose heat map, information from police precincts, just known encampment areas. And that's kind of what drives us to where we are, as well as proximity to the catchment areas of our health and hospitals facility. So for Manhattan, for example, that would be Bellevue. So we currently have 6 SHOW teams across the city. Each SHOW unit is connected to what we call a primary care safety net clinic. And those safety net clinics are I would say, really cool innovation within health and hospitals that sort of came up at the same time we were developing SHOW. And so these are primary care clinics that are designed to be very low barrier, easy to access, and geared towards the needs of individuals who have complex medical needs or mental health needs, as well as experiencing homelessness, perhaps sheltered or street homelessness. So again, we're really taking SHOW into the community and trying to serve people there who often or just do not engage in facility-based care, and pull them into our larger ecosystem of services when they're ready, if they're ready. There's a little map up in the corner. I'm sorry, it's a little small, but this shows our current footprint. So we've got 2 units in Manhattan. Both of those are affiliated with Bellevue Hospital. We've got 1 up in, or 2 actually now up in South Bronx. Those are connected to Lincoln. 1 that rotates through a few locations in the Corona, Elmhurst, Jackson Heights area. That's with Elmhurst Hospital. And 1 that rotates through a couple of locations in the Woodhull Hospital neighborhood. In terms of our services, really trying to be comprehensive primary care on the street where people are, where they need it. So we've got essential primary care. We can refer people and link people into specialty care within our H&H system or external. We do wound care. We do a variety of vaccinations. We can administer or provide over-the-counter medications. We can also prescribe medications. We have point-of-care labs, blood draw labs, point-of-care ultrasound, like really truly a full primary care shop out in the community. Again, trying to get to people where they are who otherwise won't access primary care. We also have behavioral health support. So each of our teams has both medical and behavioral health personnel on board. So we have social workers and addiction counselors, community health workers who engage around mental health questions or needs, who will do screenings or brief intervention, who will connect people to things like detox, substance use treatment. We also teach people how to use Narcan and distribute fentanyl test strips to those who are interested, and link people to services, whether that be within our own system or to other partners. And then we do have a limited array of material goods that we give to our patients when they're receiving care from us. But really, primarily, we're focused on our medical clinical services and our behavioral health supports, all also trying to help people move forward in their health and their housing needs. All of this really lives within our ecosystem of care at H&H that I referred to a minute ago. It's part of our effort, our citywide effort, and H&H as the city's hospital system to make a longer lasting impact on street homelessness, and to, as we can, as people are ready, pull people into the services we have, like primary care safety net, like behavioral health services, like our Housing for Health program, really trying to go from street to hospital and to anything else that we have to try to help people make progress both in their health and their housing. And again, just what SHOW specifically does is try to bring this ecosystem of care to where people are in the communities that they already are, and engage with them there. Specific to our Bellevue SHOW units, which are serving the Manhattan area, and one of them is the Midtown unit. We've been operating in this current form of, in this case, Bellevue employees since January of 2023. Pretty, happy with 14,000 engagements on the street. That includes repeat engagements with folks. And we've got over 400 patients who we've engaged with in some sort of like meaningful clinical encounter, engaged or connected, more than 100, just over 150 individuals to DHS for the housing process. And this, I should have included at the top, but it's important. Our staff, just to give the idea of what we do, who we have a physician, we have nursing staff, we have a social worker, an addiction counselor, a community health worker, and a clerk. So really, again, it's pretty much an entire primary care clinic in a mobile unit. And the way we operate is we set up in a given location with the mobile unit being kind of like the home base. And then the team roves, we call it roving, walks, canvas, whatever word you want to use, to known hotspots in the communities where we are, or to places where we've engaged with patients in the past to try to create follow-up and continuity there. And we find that really helps to build trust, and that trust over the long term is what gets people to take our services and engage over the long term and hopefully make progress. As a program, 44,000 engagements since 2023. We're seeing some really promising early outcome data around better connections to specialty care, as well as continuity in primary care compared to the general population of patients within H&H who are experiencing homelessness. And at this point, over 500 individuals connected to the housing process with DHS. I know we're tight on time, so I'll wrap it up. Essentially, what we do as okay, yeah. So what we do as SHOW, basically, we bring the ecosystem of homeless healthcare from H&H to people where they are, try to engage them in that ecosystem, and help the communities where we are, work through the issue of street homelessness in New York City.
And Andy, one quick question. These stats are for just Bellevue or for all your vans?
Yeah. So these, like the Midtown SHOW unit, we'll call it that, our Bellevue staff. The Bronx unit is Lincoln Hospital staff.
No, I understand. I'm
Coronas.
asking-
Oh, Andy, I
Oh,
think,
God.
so Joe, the answer on the left, those bullet points on the left are specific.
Oh, yeah.
to
I'm
Unit,
sorry. Yeah,
and
this is just what the
stats on the
Bellevue team
right
has
are
done.
specific
Our
to the whole
citywide, right?
program. Yeah.
Yes. Sorry, I misunderstood. Sorry.
Gotcha.
Yep.
Thank you. Can you take that down? And Nellie, can you put up the social service map, please?
One thing I just want to make clear that we discussed at the CAB that I think committee members need to be aware of is that I was under the impression the show van was there for the people who are at Bridge to Home. But that is not the case, correct?
No, this is supposed to be addressing the folks who are not in Bridge to Home. This is supposed to be, and the program well predates Bridge to Home, we should say.
Yes.
Nellie, we lost the social service map.
Yes, it closed on me. Give me 1 second.
Okay. So, I think because we know health and hospitals at their work at the Watson and now we're Bridge to Home, that there's not a question about the efficacy of what health and hospitals does versus some of the other providers we see. They're
Right.
professional, they're solid, they are
They
running.
are open to feedback.
Open to feedback, and they're actually running at the Watson, they listen, okay?
Yeah.
The issue we have here is not the merit of the services, but the location. Now, Nellie, can you zoom in a little bit so we see the map a little better? Right, so this is a map of the existing social services from West 44th Street to West 35th Street, to West 34th Street. And the issue we have that we're grappling with tonight is that this particular set of blocks between West 34th and West 42nd is replete with social services. So we have, yellow is supportive housing, red are homeless homeless and social services. And then the last one is temporary shelters, which is only a few left here. So the issue, yes.
Is there any color coding or way to zoom in on ones that provide medical services?
No, but we can go to, there is a list we can look at, okay? Because this is not just medical services, this is medical services and social services and referrals. Like, this is from what they've explained to us, it's a sort of wraparound, let's figure out how to help people who are hard to reach. And I want to note that the biggest issue we have, besides the density here, is that the community through the Midtown Hub has, through the DA's office, has brought in the Bridge. Bridge is an organization that works with folks who are street homeless and mentally ill. And they have what's called a Navigator program. That Navigator program has been working since when, Brian?
For at least 2 years.
Right, so for 2 years, and they work doing direct street outreach, targeted to the most difficult individuals who are service resistant. And they work the 8th Avenue corridor and the 9th Avenue corridor.
In West.
And further west when requested. So I think one of the things is that our goal as a committee and our goal as a board is to coordinate these services, that everything plugs in together. And the issue is health and hospitals, the process that should have happened was come to this community board, have a discussion, talk about it, and then figure out where this service can fit in to the community in general and connect with the other services that are already being provided. So the Navigator work is very much oriented toward these extremely service resistant street homeless here. So the issue we have is this density. And really we need to talk tonight is not about the efficacy of the services, because I have full faith in us and hospitals on doing this kind of work. It ended up here as a response to the tours that we did, the community board elected officials did for Bridge to Home, but they didn't consult with us in advance to say, where does this work in your district? Where does this work in your community? So that's why I want to get this conversation going. So starting with Brian.
I just have one comment. So I remember when, it's next to you, Laura, September 4th, and, everyone acknowledged their frustration, right? About the no advance warning, this was happening, there was no longer advance notification. You talked about how you chose it from a bunch of sites, and you said, hey, we will improve ongoing communication. It sounds, Joe, like there's no communication
At all
either. So I just wanted to flag that. It's like, I don't know if that was just for the cab that you set up for that other facility, but like, I think that's one thing is like, again, you're back and you're like, hey, surprise, this is happening. I don't think that's a very good working environment to have.
And again, we're very open towards social services and community services, but it's this constant, where do things go? Liam?
Yeah, am I correct that the purpose of this ban is to address the street homelessness that is in the area that where you're putting the ban? Like, the idea is that the idea isn't that people come from the city to the ban, it's that we put the ban there. Right?
Correct.
Okay, so my personal comment would be that I think it's good that services are coming to address people who are already on our streets and hopefully moving them to a position where they're not.
Well, I agree. However, we have a program in place. And that's the Bridge Navigator Program funded by the DA. And it's in coordination with, they have, Brian, can I actually just speak how this works?
Yeah, I mean,
No,
just a piece of.
Right, but can you speak how the whole hub works? I think that's helpful.
Yeah, so the, it's called the Midtown Community Improvement Coalition that was formed in conjunction with DA Bragg and Mayor Adams, and it's coordinated with myself as the precinct community council president from Midtown South, Dolores from Midtown North, Barbara Blair from Garment District Alliance, and Tom Harris from Time Square Alliance. The focus when we started was the 8th Avenue corridor. That is a particularly troubled hotspot. And when we said corridor, we meant the streets between 7th and 9th Avenue, 8th Avenue between 35th, 45th being the spine. In the process of doing that, DA Bragg, of course, brought in his Bridge Navigator program, which had been in operation throughout the Hell's Kitchen area prior to the conception of the hub. But we've also been working with Urban Pathways, Breaking Ground. We have representatives from Department of Social Services, Department of Mental Health and Hygiene, Department of Homeless Services, NYPD. I know I'm forgetting some entities, but we effectively have, for lack of a better term, all of the king's horses and all the king's men trying to address activity on the street.
Isn't Port Authority also part of it?
Port Authority, to a lesser extent, but they do sit in as one of the agencies. So does the Department of Transportation, Department of Buildings, Department of Sanitation. But we do days where it's focused on social services. And the incredible thing is that when we talk with social services, particularly Bridge and Urban Pathways, we know all the people on the street. And if we don't, they go and hunt them down. Bridge has done a remarkable.
Relationship building is the
Yeah.
big thing.
They've done a remarkable job there. They work all the way up to, I believe, 57th, 59th Street, down to 34th, between the 8th and 12th Avenue. So they're covering a large area, but during that duration of time, they've really got to know a lot of the faces on the street and a lot of the hot spots on the street. And it's one of the things about the bridge was that when DA Bragg came to office and became aware of the conditions along Everett Avenue, his people, his team said, oh, we can get a van out on the street. And the community said, or at least the precinct meeting said, no, please don't give another destination.
Right.
We need people that are actively functioning in the neighborhood. And Katie, to your question about medical facilities, I mean, I can look at the map and tell you what those, where they are. You know, in particular, a lot of the services such as the harm reduction services are at 37th and 8th Avenue. That's positive health housing first. And on 35th, it looks like a little tiny sliver there. That is a major facility. That's the methadone clinic that has a client base of over 600. But
We have NAMI, we have Mount Sinai.
yeah, GMHC, we have a new program, from Mount Sinai called the CARES program. We also have ACI. Brian Health, of course, that's a little bit further north. But that area is densely concentrated with services. And it is also densely concentrated with issues. And a lot of the issues unfortunately correspond to where the services are located. If I could just give a
So
few.
before you go further, I think that the real thing here is that,
Well,
I want to sort of like still it. we're not questioning the need for this kind of service. The thing is, we actually have these services being provided by providers in these blocks. And that's the thing that we would normally have a
So we're saying
conversation.
we don't need the show then? Is that what we're,
I think,
we don't need the help?
I think the issue is it's duplicative, right? We normally,
Let me ask them,
no, not them, they're not, they're,
do you find that there is demand for these services when you bring the van into the health center? Like,
Let me answer, of course.
I don't think the van has been.
yeah, I mean, this is like,
Laura?
let's go to Katie.
So it's been out, okay.
Katie, I'm sorry, Roberta. Stripes, smack me once.
So there may be some utility
Guys.
to having like a site, that like having a van park somewhere where there is demand. You said that this was like a continuation of a mobile unit that came out of the 2020s, like 2020 COVID situation, and that this program has been active since 2023. Could you explain just like the evolution of this and how, I guess, it goes from 2020 to now and the timeline?
Absolutely.
Here?
So Andy and I both actually worked on Test and Trace, which is the program that ran the citywide testing and vaccination program, including the mobile fleet. And SHOW was a part of that program originally. Andy will know kind of the exact dates and milestones, but SHOW as a kind of permanent program at H&H began in 2023, but it actually began as a part of the COVID response, I think a little bit before that. So in general, during the COVID crisis, H&H made a lot of pivots in the way healthcare service was delivered so that people could access it without having to venture too far, kind of putting themselves at risk, trying to figure out how to make sure those services were being delivered in a totally new kind of landscape. And so other programs came out of this as well, right? This is where our emergency telehealth program came from. There were tons of other sort of elements, but certainly the mobile healthcare program was a big part of the response. And I'm sure you guys remember those mobile programs being everywhere. And to the person who made the comment earlier about no notification, again, this is modeled on that process where we would submit a list of permits every week. These are where the vans are going to be. We would publish it. And that was how we were communicating information. The point being that we were trying to rotate it through the city, right? The vans leave every day, they go back to a parking lot, and then they'll come and deploy again in the morning. They have a standing schedule. The schedule is a little less flexible for the SHOW program because we're trying to work with folks who probably don't have access to a phone or other information. We haven't found that it's a draw. It's not harking back to the days of COVID when there would be a line for the testing truck or the vaccination truck. It really is hyper local. In fact, the reason they have the roving team is because so few people know it's there that we want to let people who are camped out know that the services are here, they're here for you, and they want to connect you into things, especially like DHS for a more kind of permanent continuum of care. So the program, again, it was started in COVID to think through what are the needs of people who are on the street who are, one, particularly at risk for contracting COVID and becoming very ill, but also are even further now removed from the healthcare system. So Andy, I don't know if you want to talk about the specific number of units we started.
Yeah, I think I wanted to just ask specifically about the van in Hell's Kitchen, and I apologize for interrupting you, Maria. I'm trying to understand that timeline, if that is possible.
Oh, okay. So the vans have been rotating through the city for years. There are times when they have been in Midtown Manhattan, quite often, in fact. In particular, the one on 39th Street, which is what I think is the focus now, began, I believe, 2 weeks ago. It's there Wednesdays and Thursdays from 9 a.m. to 4 p.m. Typically,
Have you had a van in Hell's Kitchen prior to this past 2 weeks?
Andy?
So I'm
Not
will
during
admit I
COVID.
don't know the specific boundaries. No. Since COVID, between COVID and now, no.
I believe we have had it at Port Authority though, right?
Let's go to.
Just want to say one final thing, which is I having just gone through budget task force, these types of services specifically reaching populations who are street homeless are things that are being consistently asked for by members of this community. And there is a desire to have additional resources, not saying that they could not coordinate better with other programs in the district, but I do think we've heard a lot of community need for this type of.
There is, the need is not to be questioned, I think.
So I just, before anyone else goes, I want to highlight something that Brian said that is very true. If you all don't know, I've worked with people for forever, okay, since I was a teenager. I love the work that I do. I love the population that I work with, who are usually people of color, people who are poor, people who have mental health issues, okay? And I want to make clear about something. Because Liam, I heard what you said about having the van there, and Roberta about like having it there, but there's something that's really critical. In human services, sometimes what happens is there is several services happening at one time in one place. That's not effective, right? And I think something else that's really critical to understand is that Brian's point that I think is really important is when you're talking about the folks that we're talking about, you don't have a van and expect people to come up to the van. You go to them. We already have the Bridge Navigator program. We have Urban Pathways who's doing street outreach, and we have Bridging Ground in this community who's doing street outreach. I am telling you, I work in front of Ryan Health. There was a woman who was there for weeks with her bags, day and night. She would come in very rarely. People would try to engage her and say, oh, there's this happening in the community, there's this, there's that. That wasn't enough, right? Really, we have to go up to her. I did go up to her and try to engage her. 311 complaints were made, but the point is there needs to be lots of contact, right? And so having a van, I think, could be helpful. But if there's already lots of services and it's duplicative, as Joe is saying, when I worked in human services, when I worked at ACS, right? One of the things we would talk about, why are we giving this family or this individual these three organizations to go to when one organization can do everything? And I just want to give you all the perspective of somebody who's a social worker and who does the work all the time. And this is from somebody who cares deeply. I just want to be clear about that. And we have a lot here in this community and we advocate well in this community.
Katie Savage, followed by Katie Stokes.
Okay, so a few things. I know we said we weren't going to discuss the merits of the program, but it seems like that is basically what we've done. If we're talking purely about the location, 36th Street and 9th Avenue is a major exit point for the Lincoln Tunnel. I'm sorry, 36.
It was originally for 36, they moved
So
to 39.
So 36 is completely out of it. Okay.
For now.
39 between 10 and 11.
Okay. Which is actually kind of where I was thinking would make sense, 38 or 39, because there is a large population there. So, ignoring that part, going to the thought of duplicative services, you know, and again, we have asked for services, and now we're getting them. I don't think it's wise to say no. And while we do have a lot of services, they're not necessarily good services. And if we have just said that Health and Hospitals has time and again proven that they are a really good operator, I would think it would make the most sense to include Health and Hospitals in the Midtown Community Improvement Coalition.
They've come.
Okay.
Yeah, we've been attending those, Katie, but thank you.
And then to also connect, because if the bridge navigators are just on the street, but they don't have a physical place, I think it's set.
They do.
Where is the physical place?
So I want to go back to what Maria said.
If you, to engage the population, we are discussing the purpose for this van. If you listen well to what this presentation is about, the population is specific. How do we help that population? And is it really having a van in one location over there? This population, you have to go out to them. That is how you help them. Really?
But Maria, I think your point.
I really want to pull this together here. we have to be clear. We are having a debate now whether this is a good service. I want to start out by saying it's a good service, but services need to be coordinated. And when you have this many red and yellow spots in the same location, nothing is successful unless you coordinate one to the other. And health and hospitals, I have been told directly, hold on, Laura, sorry. Have been told directly that this was a response because elected officials and community were on a tour and they decided to bring the van to address something. Instead of saying, we've seen this, let's come and have a public discussion. Let's talk to the other service providers. Let's figure out how to plug this type of service into the broader continuum and where in the neighborhood does this belong? It should not be that the service provider says, we know what's better. We want to talk to them and figure out how to make it work. Katie Stokes. Oh, sorry, Savage.
Feels to me overall, this discussion, that a lot of the committee members don't fully understand a lot of the background. Like, there are
Right.
probably prior meetings that we don't get briefed on. And it's just frustrating because it feels like we can't actively engage. Because the things I'm asking about, I don't know that the bridge navigators have this stuff and all this stuff. And so I think we just need to have a better understanding before we have something like this, because I don't feel like we can make informed decisions.
So I put that onto the provider to come to this committee and this community board to have the conversation in advance. So everybody gets the briefing understanding as opposed to us. This is the second time in a month we are in a reactive position. And that's because of no notice.
Have the bridge navigators present it to us?
Yeah, we had a whole major thing with the hub. Sure.
No,
Major
to the community board. Have the bridge navigators come to an HHHS meeting. I don't recall that in the time that I've been on the committee.
No, Joe, that didn't happen.
No? Okay.
So, I mean, I think it would just, again, there are a lot of people in this room who are on a lot of different committees and a lot of different community things. Not everyone is a part of that. I think we all need to have a level playing field, or else the community board is just like 10 people in front of it.
Hey, I mean, just so you know, like, wasn't like, the bridge called me up.
No, I know. It's just a broader concern that seems to come up issue after issue.
Right, and I think everyone on this board is agreeing with that. We're kind of chasing after these providers. to fill this in.
Next questions without.
Yes, Katie Stokes is next, followed by Kevin.
So, I agree with a lot of what you said, Maria, but I actually come out a different way. Because I think multiple touches is so important as a media community, right? But I think that the service that they've described is different than what outreach teams do. It's different than what, yeah, I mean, like, and I'll be honest with you, Joe, I don't find this map of broader social services proof that what this van is doing is duplicative, right? Like, I really feel like,
Did you see the other
I
service?
mean, that's why I was asking about like, this sounds like it is mostly medical services. They're doing testing, they're doing vaccines, they're doing whatever. And so, and I'll be honest with you, I don't quite understand, like, are they only supposed to be there? You know, I don't know, once, like a week, a month, or are they gonna be there for the
They
next?
said the schedule changes week.
Oh, yeah, okay.
Twice a week.
So I think that what they're doing, being one van, and that they said in their presentation that this isn't trying to meet the needs of people who are not going in and seeking traditional medical services. I actually think it's lovely. Now, listen, if we're hearing from other established medical services in our community that their regular patients are now not coming in because they're going to this van, then maybe that's a different issue, but at least for the moment, it just sounds like. Yeah,
Can I ask you
your
something,
implication.
honestly?
Yeah.
We have social service issues that are so distinct by different locations in our district, right? I don't see. It is shocking to me to say it doesn't bother you. Having too much social services in one location is a problem. And it has created a street problem. It's the fact that we're dealing with. We have harm reduction clinics that are right here.
But 39th between 10th and 11th is kind of like a no-no land.
I'm sorry, let's just go, yeah, no, Kevin, go ahead. Kevin's next and then JD.
Laura and Andy, thank you for your presentation. I have a whole series of questions, but for the sake of time, I won't ask most of them. But, we're welcome for you. But what I will ask are a couple of questions. I'm asking for you and I'd appreciate response from you. A concrete example, a couple of weeks ago, I was walking up 10th Avenue and the 55th Street made a right-hand turn. And the southwest corner of 55th, there was a unhoused individual who on both legs had wounds that you don't have to be a clinical provider to say that those wounds are very bad and they need immediate attention. I took a couple of steps and I said, look, I can't live with myself as a person now trying to help that out. So I saw a police car, asked them to try to help out. But in that scenario, one of the things that's listed for this program is wound care. In that scenario, what do you think should have occurred? That individual in that situation, how would he know this program exists? Then my second question is, can you flush out the continuity of care? If you are engaging somebody and they do engage, whether it's an acute or in a Gotham facility, and with the portability of the electronic medical record, what's the continuity of care and follow-up treatments? And lastly, what if any coordination is done beyond H&H, whether it's in, let's say, this geographical area with Mount Sinai, Ryan, or any other facility? And thank you for your time.
Yeah, no, thank you. Great. Oh, is it okay if I?
Yes,
Okay.
you go ahead.
Great.
I have been wanting to
Great
answer a question I heard before for like 10 minutes, but I'll do it after you.
I'll be as quick as I can. Great questions, honestly. So what we do in that situation, and it's what we do when we rove, is we would approach the person and we would, we have our badges, all that. We would identify ourselves and, ask if we can take a look or if they need any medical services, including taking a look at their wounds. We have a backpack that we carry that has all the supplies, kind of the essential supplies that we would need to dress a wound or, clean, take care of, etc. So we would first, approach and ask and try to build that connection. And actually, this is a great example for how we can create continuity and back to the comments before about like going to people and many engagements. And like one of the ways we've found actually we can build trust with people the most is meeting an immediate need, particularly an immediate medical need. And so our doctors are amazing and we can provide medical care, like cleaning a wound, taking a look at it, assessing it. Our providers have the medical record access on their phone so they can take a picture of it and it's documented in the medical record. But yeah, clean, dress a wound right there.
Andy,
We carry.
Andy, just for the sake of time, how would that person on 55th and 10th know that the van exists, or if the van's on where it is?
Yeah.
How did you get there?
Great question. We would find, like, we go to people, so like we would encounter that person, let's say, while roving, and we have flyers. We would let them know, hey, this is our services, this is where we are. Also, we can take care of you right here. In this case, for example, like let's say the person sounds like they're not mobile, like they're not going to walk to the van. We can arrange transportation, so we could get them a ride to the mobile unit, to Bellevue, etc. And then the
Main Street, Andy?
Sorry, I didn't hear.
The roving team shouldn't be up at 55th. No, I mean the
yeah, like
reality is
like the hypothetical, yeah.
Yeah, the reality is that if there is not a van proximate to the person, then they're probably not going to know about it, which is why we try to be very thoughtful about where we're placing it, right? So we try to go to areas where, as Andy said, the heat map is directing us, or we see a lot of overdose data because that's where we know we're going to see a lot of folks who probably are in need. The kind of reality of it is that people who are this sort of disconnected from services are not going to know where the vans are and don't come to them. They don't seek them out. They don't know they exist. So it's really on us to educate folks who are near the van about what they can do and hopefully be able to bring them into services, including into DHS for referrals. I did want to say though, and I think this is an important point that maybe has been overlooked and I should have been clearer about. The vans, so this van is here 2 days a week on 39th Street. It is not permanent. It leaves every night, but also at any point, if we say, you know, there isn't a lot of volume, people don't seem to be using it, it can move to a different part of the city. We only have 6 of these vans that we're deploying every day. We want them to go to areas where they're serving people well. And so, you know, I just want to make the point that like this is not opening another service in the way of like a freestanding clinic or anything like that. This is truly temporary, or as temporary as we all want it to be.
And for the sake of time, just to circle back to one of the questions I asked, what coordination is done? with
Yeah.
Other,
Great question. And I'll answer the second part really fast. The same doctor who's doing wound care also works in the safety net clinic. And so they would tell that person, hey, come see me next Tuesday or whatever it is. And we'd give them the information. They could come in and like, that's their doctor. We have a lot of really good connections with Breaking Ground, CUCS, The Bridge. Is the Midtown Coalition that you were all talking about, is that part of the Manhattan Outreach Consortium as well? I asked because we've had a similar conversation well over a year ago with CB3 actually.
No, Andy,
like
this is the creature of the mayor's office.
Okay.
And the DA's office. I'm sorry, we got to move on to
Got it.
JD.
Okay, because yeah, we've done some similar work with some of the same service providers in other areas of the city of like coming together to organize around our collective array of services. Yeah.
Pause you for a moment.
JD?
Yeah, I want to agree with a lot of things that everybody has said. My concern is two things.
JD, you have to speak up. They're having.
I'm so sorry. My concern is basically two things. There are a lot of social services.
Other people at.
I agree with that too.
Thank you, Andy. Keep coming.
There are a lot of social service providers in the area. I would say they're not working as they should be, because we have increasing problems, as we all know, in this neighborhood. I cannot support coming into the neighborhood with this van until more study has been done of how you're going to affect things in the neighborhood. And as far as I know, there has been no full discussion about that. Are you going to help the situation? Or are you going to make it worse? I don't know yet. I think we should just step back and before we allow recommend that this happens. My other question is, you talk about going to encampments. You talk about building trust. Does that help people get into housing, or does that keep them in the encampments? I don't know, but I think it's a concern many of us have in the neighborhood. Yes, we want to help people all we can, but it seems it's almost like a war zone here. And it seems more providers are coming in. Is this making the situation better or worse? And at this point, I don't know. So I wish we could step back, see how you're going to integrate with the other facilities if you do come in. And see if this is going to be a benefit to the larger community or not. Certainly you will benefit individuals, and that's terribly important. But the community is also important. So I'm just saying, let's step back and try to figure this out first, because I don't know. Brian points out that there's almost a correlation between drug use, bad drug use, and the social service network. There seems to be some connection. I mean, we need to explore that because something's going on
The
here.
good providers and the bad provider, which we talked about a lot, always.
Yes, and I would like to add something to what this gentleman is speaking to. So we are actually right now coordinating a meeting for all social providers in the area. We do understand that there may be some lack of communication or also, you know, a potential for an opportunity to cross-share services and really actually talk about the clients that we serve to better improve the area. So this is something that we are working towards.
Are you going to include the community in this conversation, or is it just among the providers?
It's going to be the service providers, but we do have a community advisory board that Joe, Maria,
Right,
Lee.
but that's for the CAB, and I think we need to figure out a way. I'm getting a sense of where this committee wants to go. Go to Charles, who's been waiting patiently.
Good evening, everyone. Let me just preface my comment on the fact that I've been a direct support professional. I've been a case manager, a house manager, as well as a CEO of and a co-founder of a nonprofit in New York City. And what's troubling is that there is never too much service for people in need. And for us to sit in a place where we know that there's a need and expect that providers are not going to come to match it, it doesn't take into consideration that because a provider is providing a service doesn't mean he has the vacancy, doesn't mean he has the slot, doesn't mean he has the staffing to meet that need. And sometimes we have to step back as a community and give the providers the benefit of the doubt because they're in the community doing the things that we don't do. And I think a lot of times we just have to think about the fact that services take funds in order to do it. I do believe that if there are bad providers, there's an audit process in every state agency that you can tap into to review those things. But it's troubling to sit here and say that there's people in need, and then we're saying there's too many people trying to help. I understand conjecture, whatever the word is at the moment, but I think we have to kind of think of that. I'm glad, Dina, that you talked about the service provider meeting. One thing that I found in the past that is always very helpful is in those meetings to talk about vacancies. Because I'm a provider doesn't mean I have a vacancy for someone that might literally be in front of my building. And I think that also could be some way where we kind of address, do service providers have enough in order to do the things that we need to do? And then the other thing I heard about a study. You do a study after you provide the service, after you get into the community and you understand exactly where the need is and what can be done. But I think to stop and do a study without actually understanding fully that they have to have a space, I think we could also think about it from a perspective of maybe once this is approved, that they come back to this committee quarterly and give us updates. But I think waiting in order to meet a need that we all honestly know exists is just troubling to me.
So we should just note, again, maybe we can pull this together. It's not about doing a study to see if there's a need. It's figuring out how the services all coordinate with each other. And we should be aware, this van is already located and providing services, right? And what we're talking about is, with H&H mentioned, I would say that any agency coming in, like H&H, would say, let's put all these providers together first to discuss how we can plug our services in to meet the broader need and consult with the community who actually knows what's happening here, so we can figure out a way that our services can fill a gap, right?
Hey, I'm just gonna say, Joe, I think we felt we were doing that because all summer
I
we
know
were
you-
on tours and we were shown very specific areas. And I was in multiple meetings where people said, okay, we understand involuntary commitments and we understand what Bridge to Home can do and we understand that, but there's this other population that's kind of falling in between all of that and we can't reach them and we don't know
Right,
what to
but Laura, were you asked to specifically come in these blocks with this service? The answer is no. And then when you, I would say propose them, sure, but the process is you propose them in advance, so this kind of debate and discussion happens in public. That's all, because you have people who say, we do want more services here, there's no question on that, and people are in need, but nothing's abstract. It's not abstract, this is on the ground and locations. Brian?
So a question, Joe, so talking about like the coordination that we're asking for, can you show that map, all the red and the yellow, are they coordinated? I don't know the answer.
No, that's one of the issues.
Okay, so there is no coordination.
Right, and that's one of the things we're trying to figure out. How do we get this to happen? So I'm gonna say the way to sort of conclude our discussion tonight is that, oh, sorry, Pete, I'm sorry, Pete, apologize.
I navigate the streets late at night. And I come across a number of homeless people who need these services. You mentioned that this van is available from what, from 9 AM until 12 PM? Is that what I heard?
Yes, that's the schedule.
So what's the purpose when the need is at 9?
We find that there are people who are, if they're camped out, if they're living there, then they'll be there during the day. Again, it may not address every single person's needs, but we're trying to, and I think, I would say this though, to the point about the study that was made and about having to do the work to understand the impact, we were trying to show that in the presentation, right? Just in the Midtown units that we've been operating, we've been able to refer over 150 people into DHS. So those are folks who are, at least for some period of time, not on the street anymore, which is what we had heard continuously was a priority for folks.
But that's not what I see late at night.
I'm sorry, guys, we're like really past our time, and we've had a serious, healthy debate, right? I have a few members from the public to speak. Brian, you've spoken already, so I don't want to recognize you on this, but I want to say that here, the idea that I think we should ask health and hospitals to arrange this coordination meeting, but they should invite the community board and community representatives to that to discuss this, because the issue of where the need is not just what is apparent based upon a tour with elected officials, but what is happening in the entire community and where we bring things to. That's just a very common way to proceed on this, right? And we're not, and you also have the ability to move it. So Christine.
I'm sorry, I just have to clarify one thing about that tour that I was on with Laura, and I don't think Gina was on that tour. That tour was arranged by Tony Simone. Tony was there, representatives from various elected officials' offices were there. The purpose of that tour was, we learned that they were taking residents on 36 between Dyer and 10th Avenue. And we were saying no. And our elected officials were saying, no, let us show you what's already here. This is a problematic area to run this program. We are dealing with significant issues which your patients are going to have to deal with too. So we want you to find another location. That was the purpose of the tour. And when we did the walkthrough, one of the things that Health and Hospital said, well, if we're here, and my council member Eric said this to me, he said, Health and Hospitals come here, they're gonna help us with these other providers that are not living up and being accountable. They're gonna help us with city and state agencies that are not responsive to the community. And that is what Omar and I believe Mitch and also Chris discussed doing.
All from H&H.
All from H&H, all discussed doing. We were gonna work on that, and Eric said he was gonna set up that conversation. It wasn't that they were gonna bring in additional services based on what they saw in that walkthrough.
I understand.
I will say there was another walkthrough with the bid and other folks where there were different goals. So, I just want to make clear that there were multiple opportunities for engagement, multiple points of view on what was needed. And again, this is a temporary service. If we're finding that it's not working, people are not using it, we're going to move the van. We're going to put it elsewhere in the city. And so I would just say, we appreciate all of the partnership here. I think we've been to this committee twice in the last 2 months, I believe, or 3 months. What I'm hearing is that a lot of other providers maybe don't do that. And so I would also ask if, you all can help encourage other providers to be a part of this conversation. We are certainly working hard to try to facilitate that, but I know that you all are there, as you've made the point many times to us. You are there every day. And so to the extent that you can also help all of them feed into this conversation, we would really appreciate that.
Christine Berthet, followed by Bob Benfado from the bid.
Yes, so what I'm hearing is that from the community is that the main thing we are interested in is obviously we want to take care of people with child needs, but where is your service fitting in the continuum to get those individuals to have a home, right? And that is the main thing. If the service you are providing do not contribute to that, we think they are maybe less needed than others. Okay, so that's the main objective, I think, from the community. The second thing is very narrow. the Port Authority has identified this area as one that is going to be in construction very soon, like in 1 month. So clearly that location is not valid for the duration. And therefore you need to find a new location, and that new
No,
location.
the streets are closed, there's a whole big
Right.
traffic thing happening.
Right.
There's other streets to go. Right, no, but, and that's the consultation discussion.
The point is that this specific location, we had the chair establish the goal of this discussion as location. So as a location, this place is no good because other things are going to take place. And therefore, there should be a different space identified with the community board, but also in the context of what other service we are providing, which are going to get the people off, off the street.
Yeah, we have street and sidewalk closures coming.
I'm gonna stop you because I see the time, and if you could just make your statement without asking questions, that'd be great.
Bob?
I can be quick. I'm Bob from the Hudson Yards Healthcare Center line. We actually both of them.
Yeah.
We were on the same tour with the community board and Brian, that Tony Simone put together. Because our board had met Christina, she was at the meeting and was not happy about with the bridge to home, right, opening up there. And when we learned about the bus or the van, I should say, we had my office call Laura and said we didn't want it there at all. She had already decided not to put in the canoe because they had heard from Brian, but the proposal we saw on the street permit thing was from 39th and 9th. So since we couldn't get it killed, we asked to move it west, the 10th and 11th, knowing that construction was coming. But it was described as a temporary program, so.
I mean, we're just asking, I think this is a sum up, have Judy speak last. Just identify yourself, and so I think the idea is, well,
Yes.
I know, but people don't know necessarily. Yeah.
I'm a retired health professional. I live here, and it's great, there are so many services above 34th Street. There are plenty of people in need below 34th Street. I find people on the street all the time. I sometimes intercede, I sometimes don't. And it'd be nice to have some services here. That's all.
So I think how we leave this is that we will ask you to continue your efforts to do the coordination with other social service providers. That please include the community board in those discussions because we're on the ground in different ways and different points of view. And then after that. After that. Right, after that conversation happens, please come back here, all this information, we can talk about locations, because in fact, we know factually, which is Christine saved the best for last, that parts of the street and sidewalk are being closed at that location by the Port Authority construction. So let's figure this out and also look at the broader community, not just these set of blocks. Say, here are our hotspots, here are our issues, where should this go? And if this thing works, then please, it's a general, be part of a community as opposed to saying that you've been on a tour or two and you know the best place, that's all.
Laura, Dina, and Andy, thank you for coming. The only thing I would ask also is that whenever we do hear from you again, whenever that may be in the future, is that also, maybe you said it and I missed it, but I was thinking about stats for how many people you've served in the van in the location. They did?
No, not for
Give
this
it for the
location.
Midtown unit. I mean, we haven't really been in the location long enough to.
Maybe from 2 weeks ago, so whenever we see you again, that would be helpful.
I think we're happy to provide you with the Midtown unit. I think we need more time on this individual unit. I believe that's a fair thing to ask.
Well, we'll talk about it offline.
Or it actually is very fair to ask. And we thank you very much for coming tonight and provoking.
What happened to a half an hour, guys?
I know. Well, we did our best, but we got it substance as we normally do. We can't restrain ourselves.
Well, I would say this, perhaps if you invited other providers, then we wouldn't necessarily be the star of the show.
Just so you know, we have multiple providers here all the time, and it's always a pleasure.
Indeed.
Thank you so much for tonight.
Thank you, everyone. Have a good evening.
NYCHA, Christine, can you ask the Chelsea NYCHA people come in? Christine, ask the Chelsea NYCHA people come in. There. Just hold it. We didn't hold it here. Like.
But I also, I assume that all of like men will be hot, like, highest.
Oh, really?
Like that is, I think that's
Really?
usually.
Body temperature runs like.
This is like a common dynamic in offices, where officers are being called women, but comfortable for men. Yeah. I'm sorry to all of them. I'm.
Roberta, I'm always too freaking cold. Like that's at the bottom. Like I'm Mediterranean blood.
This is a lot, yeah. No, I don't, it's not a hard and fast rule, but a general.
Thank you very much for waiting. Represent. I'll study.
Are we gonna play the audio?
Yeah, I mean.
Cause I didn't have such, like, when you got uploaded.
Yeah, I had it working.
Yeah, I mean, I'm the gist of it.
So everybody, we're gonna convene.
Somebody raised their hand, but I moved the time.
Oh.
Oh, that's a tenant, bring her over. There's a tenant from last night, from Chelsea NYCHA. Nellie, can you bring over Savasha? She was here last night.
Okay.
All right, so put on our agenda on an emergency basis, response to the incident that happened at Chelsea NYCHA regarding relocation. And Jessica, Maria, myself, Jesse, and have talked about it, how we're gonna manage this. We're gonna hear about the information, but we're gonna take an action tonight, on a very limited portion, which is really about how relocations are being handled and the involvement with the NYPD, because the board's gonna take an emergency action to send out something to our elected officials and NYPD about this.
But
So-
also we request.
Right, and request a meeting. So we're not dealing with the whole of Chelsea NYCHA at all. We're dealing with how something was managed in a way that was really not what anyone expected to happen, right? So let me just set the stage a bit and then folks will introduce themselves. There was a relocation scheduled last week at Chelsea NYCHA from the senior building. During the course of it, the tenant called neighbors saying she did not want to move. Neighbors then called other people and called other neighbors and called advocates from the community, from the coalition around the Chelsea NYCHA issue. They went to the building, and when they went to the building, and there were many neighbors in the hallway back and forth about this move, HOU, that's the consultant to relate it, right, that manages the whole relocation process, called the NYPD to come to the building. And the NYPD, and you will hear, we're gonna play an audio clip first on this, was misinformed that the building had been sold and was no longer NYCHA. And everyone agreed to move and they had to move. Now, I work in affordable housing for decades. When you have a tenant, for whatever reason, who's being relocated temporarily or permanently and they want to move, so they're not gonna move, you pretty much pause what you do, and you don't, I mean, you deal with this to the courts, whatever, right? It is so unusual for the NYPD to arrive, but more important, you'll hear in this audio clip that we have in the Dropbox, you can listen to subsequently. Nellie, can you cue that audio clip up? That the police are relying upon information that is totally incorrect. And then talking to a tenant, which is truly incorrect, like totally inaccurate. So, Nellie, can you pull up that audio clip? And it took me a while to understand this was even real. When I heard it, and I was like, "Who recorded this?" This was one of the, actually, she's here tonight. It was at Cologne. One of the other tenant advocates who's been involved in this for like the last couple of years.
We also have video.
And it's his video too. So again, it's a very narrow thing we're talking about tonight. Go ahead, Nellie, play the clip. We're not hearing it, Nellie.
Is she finding?
No, it's playing this.
I'm sorry, I'm trying to see, I might have to stay unmuted. Hold on 1 second.
Right, you can't be muted coming from you.
Yeah. We are supposed to be moving, but we don't wish to move.
That's the tenant speaking.
I'm not sure why it's supported. Yeah, we are not causing any trouble.
Wow. Okay, so tell her there is no trouble. Tell her I'm here today because, what was brought to my attention is that this building is no longer considered NYCHA building anymore. And she signed a paper willing to move on Friday, and I wanna know if that's correct.
I'm sorry, the building is no longer what?
NYCHA, like housing development, like public
That's the
housing,
translator speaking.
sold to like a private person or whatever. And this building is gonna be demolished at some point and rebuilt. So that's why they're moving everyone out of the building. I wanna know if she signed the paper in agreement to move out on Friday with this establishment.
Có người thầy ở ngoài đây mà
My.
rồi thầy đấy cái con chỗ tại hạ đấy thầy买咗俾一筆私人公司就會拆噶啦，所有嘅人都要搬出去。喺星期咧，你係有簽咗個同意書話搬嘅，你記唔記得你有簽嘛？邊個老闆唔啊？You just last Friday?
Please, officer, I'm sorry, but the information you provided is not the truth.
Who are you, ma'am? Who are you?
My name is Lisette. And
Okay,
yours?
I spoke to the 911 call in, that's what they explained.
Okay,
So that's
but
what I'm trying to get that.
911 call over there, show you.
She's the person that lives
You
here,
verify
right?
that.
Here?
No, we always, listen, Lieutenant Rivera, Rivera.
Hold on, give me 1 second.
Okay, but
She has to do one thing at a time.
Okay.
Can't listen to you and listen to her at the same time.
But we cannot interpret something to somebody which is not true. We cannot translate something that is not true. You're giving information.
She's asking the person.
I was told that she signed a document. I was told by the controller.
You translate something that is not
Like
correct.
everyone else in this
No,
building.
she's not telling her, she's asking her, did you sign it?
So mean that the building is going to be demolished and everybody has to. It's not a fact. It's not a fact.
Nellie, if you could just pause it there, and I think we got the gist of it. So if you guys both can introduce yourselves as to who you are, from which building, whatever, in your role.
My name is Jane Rao. I live in the cross street.
Hmm?
The 466 building.
In Chelsea NYCHA, yes. Ma'am?
My name is Yus Story. I live in a 43627 driveway, just.
The senior building, yes.
John Mudd, the 10th Afternoon Council.
Lydia Andre from Chelsea Neighbors Coalition and Chelsea Public Housing Coalition. Lisa Colon, Chelsea Public Housing Coalition.
Wei Tam, I'm one of the Cantonese translators for the Cantonese tenants.
Got it. So if you could just describe to us very succinctly, Lizette or whoever, what you saw, witnessed, because our concern here is not about what the future of the whole project is, it's how it's being executed and how we are making sure that people are properly treated and engaged.
So on October 29th, around 12:30 p.m. One of our interpreters for the Mandarin tenants sent us a text saying something is happening in 90. And she sent us pictures of boxes that were already packed outside the apartment of this tenant that had decided that she didn't want to leave. They were already packed outside. There were 14 boxes outside. So when we saw that, Wei and I went to the apartments in question. When we got there, we found Jane, and we found the story. John was already there. And the tenant was just telling us Thank God, Wade was there because she speaks Cantonese. She was telling us she didn't want to know, she didn't want to know. So all of a sudden, the police comes and they come inside the lieutenant Rivera thing. She didn't ask us for any information. She just erupted into the room, saying, okay, what is going on here? And she asked, we said, she needs an interpreter, so she called the interpreter from the police.
Oh, on the phone.
On the phone, and she and the interpreter was just heard that. But unfortunately, she was not sharing information to the interpreter that was accurate. She was saying that the building had been already sold, just like what Joe was mentioning, and that they had to leave. And I was mentioning, and I don't think that you could hear well, I was mentioning to her, it's not right.
You were speaking very quietly, yeah.
Yeah, that you are giving her information that is not accurate to the interpreter, because then that interpreter will share that information with the tenant, and that's what she will understand. And she became very upset. Then she asked, who are you? And then
The police person.
the police person, lieutenant. And we identify ourselves as advocates, and that the tenant had invited us to be with her, to be supporting her, especially with Story. And then the lieutenant said, you have to get out. But in a very good way, to the point that later on I submitted a complaint with the police because she was extremely rude with us, like making us feel like we had invaded the apartment when we were part of her support system. She asked us, the other officer also was very disrespectful and she's disrespectful, and she said, you have to leave. And I said, but you have to talk to, well, anyway, they kicked us out and they stay inside with the tenant. We don't know what she was told. She was with that interpreter in the phone. Wei was already eliminated from the picture. Wei had been interpreting for her all the time. She was only counting on the interpreter from the police. We don't know what happened. They allowed the HOU woman, the representative, to go in without us. So even though they kicked out the advocates, they allowed the HOU people to be there. We did not understand that at all. But unfortunately, when they come out, or fortunately, the lieutenant admitted to us, we are not supposed to be here. This is not our jurisdiction. We should have never been called. That was the lieutenant.
They should never have responded to that
Yeah,
call.
they should have never responded. The NYPD should have never responded to this, really. So they left. They admitted, the lieutenant admitted that to us when she was leaving. So I said, but you already gave information that is wrong to the tenant, and we don't know what happened. So then the HOU woman goes again inside. We are staying still outside.
In the hallway.
And then all of a sudden, the tenant comes out with the HOU representative and the grandson. They said, we're going to show her the apartment.
How old is the tenant?
How old is
76.
76 individuals.
What's HOU again?
Housing opportunity,
It's the consultant for related.
so they are the intermediary. No.
No,
They're hired by.
they're hired by related.
And they're the ones that are supposed to give social services, and they're supposed to give advice to the tenants, but in this case, they're working with the developers entirely. I mean, that's the experience that we have had, and I just want to share that with you. So we are there, we are shocked, we don't know what is going on. Miss Story, the woman wants Miss Story to go with her. The HOU representative said, she stayed quiet, but then the other representative, you cannot go because you have been harassing us. The woman from HOU, she did not want Miss Story to go with them.
And you're a neighbor.
And she,
Never.
yes, and she's a friend of.
Friend.
So we have never seen that we, as advocates, we cannot be with the tenants. It's unbelievable. I don't think that you can imagine that this is happening.
No, it's happening 5 times a day.
But sadly, they go, and then we met them when they come back, because they don't allow us to go. She was able to impose herself, and she stayed in the elevator, and she said, I'm going. So she stayed with her. She goes and she sees the apartment with her. She can tell.
Can't go inside too.
But she couldn't go inside the apartment when she.
So you went to another building
Yeah,
for relocation apartment.
They kept her.
Yeah.
The relocation, I just want to tell you that in the relocation building, the
elevator is, you have to do it manually, it's not working. The woman has a disability, she cannot open that. When I confronted later on the representative, she said, well, at this point, she doesn't have any choice, she should have asked for it, an apartment, when we were offering them at the beginning. Now that's the only thing that we.
So they're telling people, because you didn't go early, you don't get an apartment that meets your disability needs. That's what
So,
they said.
so keep on the narrative. Soon.
Okay, so when they come back, they allege that the grandson is the one that is making the decisions for her. For the record, he doesn't have any power of attorney, he doesn't have any legal.
And I wanna note, that the representative from the AG's office, when this complaint was sent to them, did a full investigation. And they wrote back to the community board saying that there's no power of attorney, there's no legal representation, there's no guardianship. And that, I mean, they confirmed some of these things that were being asserted, which I was kind of surprised that the AG really spent like a day and a half figuring out what happened here.
So then, as the woman was, the tenant was, adamant, I mean, she was very firm, I'm not leaving. We said, okay, so we will put the boxes inside so that you will be able to stay in the meantime. But there were so many, there were 14 boxes already out and there were steel boxes inside. So there was no way for us to accommodate everything. And they said, don't, the other ISHO said, you can leave them here while we decide what is going to happen tomorrow. So we left them there that day. And as of today, the woman, the tenant is still there. She doesn't want to move in her apartment. She doesn't want to move. And every day she keeps saying, I don't want to move out of here. So we just coming here. I know that you have helped us enormously. And you made a wonderful letter and you took a stand. But at this point, we need you as a community board to hold the elected officials accountable. They're supposed to be the one, we're not supposed to be by yours, they're not supposed to be by themselves. Every single day they're being harassed. On Wednesday, we went to court, yesterday we went to court, and the judge told everybody there, HOU cannot go and tell you anything until I make a decision. And I have until December the 4th to make any decision. So nobody can be moved, nobody can be harassed. That same day, that same afternoon, they were harassed. Today, they were harassed. So Ms. Story was telling me today, everybody knows what is supposed to be happening and nobody's standing for us. So I'm just asking, begging at this point, HOU, they keep telling them the following, if you don't move, you're going to be without a home. Just like that. No, in person. They go in person, and I'm talking about senior people. This not, I mean, even for me, it will be difficult for me to hear that every single.
The building Elliott Chelsea is 100% seniors, the first.
All of them are seniors, so I'm just asking you to please figure out a way to hold them accountable. And I mean, hold them accountable and also to ask the elected officials, where the hell are you? Oh, and also the directory, the
Intercom directory
has been disconnected since October the 26th, was it the day that? Yes.
Only from that building or
No.
every building on
All the
campus?
buildings now, they don't have directory. When I asked them the day after, they say, oh, we're fixing them. It's already November the 5th, the 6th. I mean, come on. But exactly, this is a representation of the disgrace of NYCHA for many, many years. This is not news to any of us. But this is time to just stop this. Stop it. And we are seeing it from, we're seeing it every day from people that we know. So I'm just asking you, I don't know.
Let me ask a couple things, Cam.
Yeah.
Tam, we heard the back and forth on the translation. Of course, we don't speak Chinese. Could you just tell us, you've spoken to this tenant, what has she said? You filmed it?
Send that to you.
You filmed it, the 2 videos. So can you tell me, just recount what you saw? What was she saying back and forth to you?
Translate what John was talking with the grandson. She does not want to move. And I was told that the grandson had signed the lease. And that's not valid, that she didn't sign it.
Right, because grandson is not a tenant, she's a tenant, right?
No, the grandson lives in Connecticut and is only there for 4 months. And he's tired and he just wants to remove her. And also one of the sons and another lady. I was there the whole day and I filmed 2 videos.
We'll share the videos with the committee. I'm sorry, didn't get those to the
It's
Dropbox.
33 minutes and 28 minutes.
Okay,
So there's some video of the HO people and some video of the cops, very the little, but I stopped filming when the cops came, so. But she's, you know, she's got some issues, but she's very firm on, you know,
Her
staying.
position.
She wants to stay in her building, she's scared, she does not want to move to the next door building, 426. She's old, she's a senior.
She can't operate that.
She can't, and she told me she's got back problems, something, I think she had surgery and, she cannot, pull the elevator. So,
so make hear the neighbors first, just the neighbors, you can just, yes.
Why were the boxes packed?
That's what they do to everybody.
sorry, HOU said, that she signed the lease,
No,
so
no.
that's why they packed the boxes.
No, let me interject here. What they did is they came with they got her signed a move order.
A relocation
And,
agreement.
and she didn't know what she was signing. And the boxes were out there and they said they wouldn't move them. They actually moved them. They're gone. They had her, we had to loan her some clothes to get her to the court.
But who
They-
packed the boxes?
HOU.
So Joe, before we move on to any more questions, I'd like to point out, this is consistent, all the stories that we heard leading up to this, and all the conversations, and this was pointed out to Eric.
Yes.
Our council.
And the last major Chelsea Mansion meeting we had, that he said he would not take a stance or make a vote in any way if he thought that the majority of the people were against this. He also ignored the stories of the harassment. You're sitting in this room, take this back to your boss, he's full of shit. So he needs to be held accountable for it. So we keep going with me.
I just want to add something about the boxing and I just want to tell you that another tenant who finally said, okay, so move me, that's fine, I will move. They packed everything so fast because they're supposed to have a whole week, but they packed everything in 2 days. And she was not present when they were packing because she was supposed to go and get the keys. So when she comes back, she couldn't find where were her medications, where was her charger, because they put everything inside. They don't label what are they putting there. They just, not even by bathroom, kitchen, no, 1, 2, 3, 4 by numbers. So you're talking about moving elderly people by themselves. There has to be some dignity. I mean, some dignified system, process. And it cannot be just, okay, let's move out. They just want them as fast as possible to get out so that they could have the building.
Okay, so let's continue with the neighbors first, so, yeah.
I am living the 436 14
Mhm.
and she is, the Miss On is my very good friend. Because why I know her, because she back had a surgery. So my doors have, so if she see me, I always have her push the door, let her go in. And the day happened to they living, the man is living 80, and she living 90. And the 80 person called me. They said something happened to 90. HOU, comes lots of people to her house. Well, packing something. And then I very, very afraid. And then I called my friend, I called Elaine, my friends. Ivy. And then somebody, I called Renee.
Renee, the president of the tenant association, right?
I said that something happened. I maybe can't, go right now, I do nothing. So I called her after call and I go upstairs. Go downstairs, sorry. I would go downstairs, I see, lots of people, they here, everybody's there. And I saw the police and I saw she's around with the eight, the people.
With her aide, right, her aide.
Stay in house. And she and talking with the manager, HOU manager, Karen.
Caitlin.
They always, because she wants to go in, and this Adam said, no, you can't go in. I see they busy talking, I'm not going. I am. They're busy talking. Oh, I'm going. I ask for what's happened. They said, those people low, they come in. I said, don't want packing. I don't want to move. Don't want to move. But they did not listen to. They just packing, just looking like this. Secret food, forgot the box. Suddenly, $14, sorry. Maybe only 10-15 minutes to do this. You know, that's why she can't find any clothes. Yesterday, we had to go court. And she had no address. And then 80 people, the wife, his wife, he said, I have coat for you. That's why he.
Oh, she had no coat.
No coat.
Everything's packed. Packed
And
up.
exactly where that.
Yeah,
So it's too low. And we went, seeing all of our residents, they're coming to our building. We were scared, everybody's scared. We worry because next is me. Right? So I don't want talking, people don't want talking here, those people, actually, especially the ladies. She's talking every night after 5 o'clock, 7 o'clock, 8 o'clock. She's still running to the every family.
Knocking on your door?
Knocking the door, talking every family. And say, no, I'm nice to you. You can move. I give to you. How beautiful house. Right? You do not move. People say, no, I don't want to move. I live here long time. Nice the place. I enjoy my restaurant. Me too, right? Enjoy. But she said, if not move, okay, you got a problem. What? You have no housing, no house. Because
She
people.
said to you, if you don't move, you'll have no housing.
Because, yes, we have somebody, they talking. You can see the.
The transfer doesn't.
You can see the recruiter and said, look, it's something here. And he said, people said, my mother 90 more years old. How can she move? She probably have to move another. She live in the senior building. Maybe she have to move another building, right? Another senior building. She said, no, we don't have the program like this. We have no.
This is Miss Caitlin.
Yeah, we only have.
This is Miss Kate.
The other. But not Miss Kate. Go, Miss Go. The word is Chinese.
Oh, the Chinese speaker.
Yeah, yes, she speaks Chinese. She said, no, if you not move, we don't have the senior building for you. If we have no senior building, what do you do? Yeah, she asked for the men and the old people, not remove the lady's son. What are your mother doing? If we have no another senior building, what you doing? This guy say, okay, we have stay. What are you doing? Stay the house. Right? We can't move to the government building. We need to move to another good senior building. And they say, we have no senior building. You have to go.
Yeah.
If you not go, okay, you have no house.
Nobody should ever say that to you because it's not true.
Just a
They
point.
said all the time.
Let's go, last person, yes, so can you just,
Okay, I'm just a friend of the 14G. So every time any crisis happen in that building, the first person to call is me. So I heard that, and also the tenants just text to us. They said some forceful moving is happening right now. The other tenants in 12G also text to me. And so yeah, because I speak Mandarin. So I called the John and Lisa, and so I went there. I witnessed the police train, and I witnessed the lieutenant told that the building was sold. When I heard that, I was shocked. They say it's not belong to the NYCHA anymore, and everybody must go. So we said, told us, no, it's not accurate information, but they just keep saying that.
HOU keeps saying that.
Yes.
Right, okay, right, so.
And keep in
That,
mind, there's,
and also I heard the 7C, and the lady was laid down over 90 years. And she just lay down for sick. Then they call the son every time. If the parents was old, cannot move, they just call the kids. Every kids they called. And just let kids persuade. Persuade the parents to move. No matter what kind of situation.
We've heard that story.
Yes, even we saw just someone, another in 13 something, right?
Yeah.
The man was 97 years old, was sent to the hospital.
97 years old.
Yeah, 97 years old. When he came back, the day before, he was,
She was shit.
yeah, he was vomiting in the hallway. And we had picture of that. Then ambulance sent to the hospital after treating, it just sent back. The next day, it was lay in the, how to call it, just ambulance.
And stretcher.
Yes, stretcher, and move out, because the daughter signed. Not signed.
Eight people signed.
Is it okay? Is it okay if I stop you
Yeah.
and allow committee to speak and the people online? Is it
Oh,
okay?
sorry.
Thank you. I just want to express, I'm extremely frustrated. Right now, I'm okay. A few minutes ago, I don't know if you could tell, I was really frustrated by this because it's not okay, right? Even if you are in full support of demolition happening, this is not okay to be treated this way. And in my mind, I think we need to have a meeting with NYPD and HOU, and it would be great if your boss could lead the meeting, right? And I want to share that the last meeting we have with the AG's office. Well, I wasn't gonna mention, there's so many meetings around this. It's unbelievable. I think what's really significant here is we had a meeting with the AG's office, the Attorney General's office around this. We've had one about once a month, I would say. And the last one we had, he flagged two things for us that were significant. One around financing, and the first one, I can't remember what the first one was. But I can't remember right now, but my point is that there was discussion about how many people have chosen not to leave yet or relocate in the senior building.
We were told there's only 7 people left in the
We were
senior
told
building.
that there's 7
they're not
holdouts,
way near there.
and
What does that mean?
and my understanding, yes,
So
is
now-
that there's a lot more.
Yeah, I just want to understand, are there more than 7 people in your building?
Wait, let me tell you this, in the courtroom yesterday, there were 35 people inside, there were 40 people on the outside. That's 75, some of them, you can imagine, they're lawyers.
But I'm asking about the senior building.
We have 18 intake forms. We have 40 people consent forms, over 40 consent forms for cease and desist. And they returned to cease and desist.
From the senior building?
From the senior building.
But Joe and Maria and everybody, as days go by and they keep harassing.
Yeah.
Of course, next week we will have less, but it's something that has gotten worse.
Oh, that was the
It's-
first thing, thank you. The first thing was around, and so I believe the reason that this is occurring is because they want to close the deal by December, right?
Exactly.
So you have to get people out as soon as possible. It's a problem that somebody needed to be relocated and the police were called, that's not okay, right? And I urge your office to do more here. With that last meeting we had at the AG's office, that's the first time I saw the three electeds give some push and ask good questions. And I'm sorry, but Eric Botcher's question was, well, how can we help the 7 people move? When Tony and Brad asked something different.
Wow.
So I just wanna know.
I am extremely frustrated here and really what we need to do is talk about what are we gonna do? There needs to be a letter and we have some other stuff on the agenda, so if you could.
Go ahead,
along quickly
JD,
with this.
JD.
I think immediately, Joe, immediately, tomorrow morning, we need to contact the precinct.
Oh, and Hector
that
has
sent
scanners.
These cops, either Jesse or Jessica can do it immediately to inform the precinct that this building is not controlled and that they should not send officers over. That's immediate. We can do that tomorrow. The second thing is, I think we have Eric's representative here, MOA or whatever that group is.
HOU.
HOU needs to be talked to tomorrow.
That would be very.
Tomorrow
I'm sure they-
morning
Yes.
to stop this.
Yes.
And Joe and Maria, I think you talked to Jessica and Jesse, to tomorrow morning.
Yes.
Just a point on the police, there was 3 rounds of police that came, okay? The first round came in and with the same attitude, the same voice. And what I did was I was in the hall, he threatened to arrest me. And he told me to step in the building, that's when I asked for his superior. And I believe she was a lieutenant, she came in with the same voice,
We
the
need
same
to
attitude.
talk to them tomorrow morning and say this, no more of this, do not come to the
So-
building.
I just wanna give you the broad context is that, NYCHA does pact conversions, relocation stuff all across the city. They are not handled or managed in this way. It was in the meeting that Maria's talking about, they said AG's office, but it actually was a meeting of the stakeholder and the AG rep attended. That we spoke about specifically the question of relocation and what happens. And there was this push to say that Related stated they wanted to close this financing by December 31st. When the discussion occurred, we said that is not a reason to accelerate relocation to be done poorly and to have people coerced or an issue. All the electeds were like, yes, yeah. And we heard for the first time from State Senator Hoylman and from Senator Simone that the reason to close a deal was not a reason to push relocation like this, because the Lucy Newman from the Legal Aid Society said, we are familiar with this. It takes 6 to 8 months usually to do these conversions. And there is the whole they use the word robust. There's a serious process where people are back and forth. So when there's people who are elderly, or there's families that are doubled, all the multiple circumstances that happen, this gets worked through and people are brought along in the process. And then in the end, there's always gonna be some holdouts, that happens, right? But that's not where you start. So the concern here is, which you've reported today in a real clear way, and Quentin, this is the one I want to get past, get out back there, is that HOU is telling people, if you don't move, you will have no housing. That has to end, because that's not true. And the other part, how this process works, is we've learned clearly, NYCHA has an internal administrative process. The tenant says they want to move or don't want to move, they're not gonna move. NYCHA must bring an internal administrative proceeding, right? A right to counsel. After that, what happens is, then they go to court. And this is adjudicated in a court. That's how it works across the city. So this is, and I said this to my council member, staff member, I said, this is slumlord tactics.
Yes.
And excuse me, no editorial here. It's slumlord tactics because our community, certainly in the Hell's Kitchen area, and in Chelsea too, has seen owners take tactics. You must do this, knock on door, coerce, pressure, and that's not how you get my response was, you don't get a good deal done. You don't get a proper project done in the end. So no matter how you feel about this, it's not how it should happen.
And before we go to Hector, because we're gonna do the committee members now. We'll do the committee members now. We can hear from you later. One thing I need to correct Joe. I'm looking at my notes. Wednesday, October 22nd at 1:30 CB4 in the AG meeting. Number 1, NYCHA impact quote unquote need to close by December. And number 2, how this will be financed. Okay, those were the 2 main red flags at that time.
And who was red flagging that?
Brent, I forgot his last name, Meltzer.
Brent Meltzer, who's the chief housing person.
Great.
Hector, you've had your hand up the longest, so I am going to you next.
No, I'd rather I'll wait for Joe to come back into the room, please.
Okay,
You
so
can
we will
you
go-
can move
I
on to
don't
somebody else.
Okay, who else from the committee would like to speak? JD, oh, wait, I saw Katie's hand first. Katie spoke.
So first, actually, I wanna say, I think you guys are such a great group of friends and advocates, so I applaud everything you've done and how supportive you've been, so. If everybody could have advocates like you, we would have a better world, but, but I also wanted to say, JD, I totally understand like your frustration and saying we should call the police and da. I think us calling the police and saying like, this is our opinion of what's happening right now isn't gonna be so
I
effective.
don't agree with that at all.
Wait, hold on, just let me finish, right now. So, I think that we should have a letter that goes to immediately tomorrow, or, as fast as we can draft the darn thing. And that it needs to go to the electeds, and it needs to copy the state attorney general's office, because I know they've been very involved in this. And frankly, legal aid, the lawyers that have been involved, and say, there is terrible harassment happening here. Who is gonna come in and, there, frankly, it sounds like there should be somebody in the building. I think we should demand that there is somebody in the building every day. Yeah, like whether it's a monitor or some sort of legal advocate who can be answering the tenants' questions and telling the tenants what's actually happening. What we need here is somebody who has all the facts and can be articulate and advocate for the tenants, and that somebody, that's the person, or there, it needs, whether it's a state attorney general's group, they're the ones who have to call the police. They're also, somebody has to say, look, there's a court proceeding happening right now, right? Like, this all needs to be summarized, but us doing it isn't right. This needs to be coming from somebody with authority on it.
We're the only place that the public can go, and that's one of the problems.
Right. So they're coming to us, but now we need to get the letter out, but asking for effective advocacy, right? So I really do think that we need to have a letter, an immediate letter, an administrative, whatever that
Right,
is.
yeah, wow.
That's going to our electeds, but also the state attorney general's office, the legal, I don't know what the group is called.
Legal Aid Society.
No, I mean, there's separate, it should go to legal aid society too, but there's a group in the state attorney general's office
Housing,
that
yeah.
is focused.
Yes.
Right.
Yeah, they're working on it currently.
Exactly, so whoever that office is.
Yes.
And we have to say, and we want confirmation immediately as to who's contacting. Frankly, in writing, the police department and advising them, like, here are the facts.
Well, I did verify that the 911 caller, I verified this with Carter Wilson from council member's office, was HOU.
Right, but
No,
I want,
point is different.
yeah, but the point is to have somebody inform the police about what the actual facts are, and that they should not be getting involved here, right? And that it's.
So I put out a little fact sheet saying, here's what it is.
Yeah, so I think they need that immediately. Hold on, what else was I saying? Yes, so I think that we need to have all the facts and then we want confirmation that somebody is going to be in the building and talking to like a lawyer, or legal advocate.
Yeah, the monitor legal advocate in the building every day.
Talking to them.
About their
saying-
rights and their
about their
program.
rights, exactly, yeah. And also, you mentioned that somebody at the AG's office has looked into this particular situation about this woman who was
Yes.
trying to be forced out. So it sounds like hopefully they've been in touch with her and.
No, that individual actually, I'm amazed. He called the family, he got a translator.
Yeah, that's what I've heard, is that office at the AG's.
They
office
were
is
dead serious
really
about this,
involved,
right?
So I think we need to get them involved and we have to have them be the one.
And sorry.
Yeah.
Who's next? Sorry.
Okay, so anyway, I would just suggest that that's the letter, right, is saying that there needs to be, immediate, addressing of this issue, not just by the electeds, but by the lawyers, and that the current judicial process also has to be explained to people who are in the building so that they know what their rights are.
Okay, thank you. Can we go to Hector, please? He wanted to wait till you, yeah.
That's
Oh, yeah.
fine, I don't.
Sorry.
Okay, all right. Good evening, everybody. I want to provide important clarity about that situation involving the early Chelsea resident who actually was in the senior building. There have been claims that this resident was being forced out of her home. That is false. The truth is, a support team from HOU was at her apartment for a pre-scheduled appointment to help her pack for her planned relocation. Her son and grandson were present and cooperating. The HOU staff acted with professionalism and genuine care for the resident like they do for everybody else within the FEC developments. But they were overwhelmed when a group of agitators, some outside, some local residents, arrived in numbers. They crowded the hallway, created attention, and some even entered the apartment without permission, moving boxes back inside. Would real caring neighbors act this way? Then things escalated even further when an NYPD officer repeated a false information from an unknown 911 caller said that the family building has been sold. That was completely untrue, and it caused a resident panic and distress. It has since been confirmed that neither the family nor the support team made that 911 call. I wonder who that could have been. This is a part of a broader pattern.
Today that it
Fear,
came from HOU.
misinformation, disruption being used to create chaos. No credible outlet reported this, only a self-published newsletter known for false narratives and opposition to the redevelopment. And let's not forget, the same group recently had their lawsuit dismissed with prejudice after submitting AI-generated false statements to the court. So I ask, these people truly protecting residents or causing harm for their own benefit with no for people they hurt? And to those who continue to particularly support or defend these individuals and their behavior, especially while calling themselves professionals, community leaders, or people just trying to make a name, then your motives must also be in question. And I'm speaking as a resident of Fulton Houses and formerly of LA Chelsea, who has had plenty of years living in this environment and knowing exactly what has been happening. And this has been, all the residents have been notified for months, years, knowing that this was coming. So for you, Johnny come lately, to come over here and make all these statements is laughable, okay? And I know most of you over there that are present right there were there uninvited in the apartment. There's video, there's witnesses, NYPD can corroborate all this, okay? So you can show all the videos you want, and I would like to see them undoctored, really. That would be really appreciated, so we can see the actual facts of it, okay? Thank you very much. And I know, yeah, I think that's a really funny object there over here, really. It's really laughable, isn't it? This is not laughable at all. This is about people's lives that you are putting fear into. Get the facts.
Okay, so let's note that I verified today with Carl Wilson, Eric Potter's chief of staff, that the 911 caller was from HOU. That's the information he gave to me. Second, we are not talking, Hector, about you were not there. We're sitting with 1, 2, 3, 4, 5 people who were physically, 4 people.
I had a major meeting with people who were present at that moment, okay?
Right, who were physically there, who actually know the tenant and have known the tenant. How long have you known the tenant for?
With her?
Yeah, how long you know her? 5 years. So these are not people who have arrived, Johnny come lately. There's people who have there's a relationship. It's a community in this building, right? You may not agree, but they are not the first group of tenants who have talked about poor treatment or below par treatment from HOU. So this is an ongoing process. And I also want to know, for the record to everybody, we have never in our community called different groups that form friends, neighbors. We never called them outside agitators before. That is a Trump play, and that is not something I think we can subscribe to. There's always going to be in the community various different opinions and people asking to support their neighbors or friends.
Right.
And
I respect that, but there's just fake news being given out. Then that's a fair problem.
And not everybody's running for public office. So let's go. Those are the 2 things in the letter, right? Do you have more points for the letter?
Yeah, she gave them and I wrote them down and it lives on YouTube, so.
Yes. So
We have-
yes, Kevin, and then Roberta.
I'm just trying to make a constructive suggestion. I'd like to hear your thoughts about the letter, right? But my understanding of the process is a letter, if it comes out of the committee,
No, it's gonna, on an emergency basis, we cleared this already. Gonna happen right away.
you clear with who?
Jessica and Jesse. So we figured out how to do this to get it out there, probably administrative, so.
Good, Rod, come on.
Yeah,
You cleared something with them before the committee meeting?
on the process. No, not the substance, but we had to, I asked, since this is such a serious thing, how do we manage this? And they
We
agreed.
can wait until committee to have a discussion about. what
And
happened.
December
And
board,
Jesse and Jessica were involved in the emails, specifically from the AG's office.
right?
I got you.
That's why we sort of like, how do we manage it? Because it's like, this is so weird. Right.
So in addition to,
He's crossed that.
speaking with the NYPD, and having, a letter of the HOU, it would likely be helpful to know, and perhaps NYCHA will not give this information, to know which how many tenants are still, within the building, and it does appear that there should be some sort of connection, those tenants, with either legal aid or the AG's office, or both. And there may be useful to, for the community board or another, like, outside organization to just understand who is physically present and ensure that the rights as tenants are protected. There is not staffing or availability to do this. There should also be just sort of, it could be written basic rights. This may wind up becoming something that the AG's office or legal aid wants to do in the
Anyway,
future,
right.
because there appear to be some gray areas that should be clarified, perhaps from an official source or a trusted source. The community is trusted, but like.
Correct.
And so I would also just add that to the letter and to confirm was that the court proceeding you were referring to, that is supposed to be heard again, I think December 4th, is this, it's effectively like a anti-demolition or stay that is being pursued, that was the judge in October, I guess the beginning of October, said no, we can't submit this, but we're gonna let you resubmit in December, and then that's gonna go forward in December. That's what you're referring
It's
to.
a matter of standing.
Yes, yeah.
Right. So just to note that the AG did request those stats. And the community board was copied on that. And the reason I raised it tonight is because the stats were not accurate. And that's very disturbing, because the AG is not happy that NYCHA presented the stats. And you sit here tonight and know that there's more than 7 people in this senior building.
And the AG's office is having meetings, I don't remember if it's weekly or bi-weekly.
Weekly now.
With Related Essence and NYCHA.
So
we get an accurate account of.
Well, I think one of the things that's come up through this incident is to ask, we don't have people's names, but produce the numbers flat out, because one of the things that happened in this back and forth, I spoke to Carl a couple times about this, is it was reported that the woman in question had been physically relocated and had moved. And we learned yesterday she had not moved, although she's still there. And so we were told, myself and Carl were told she has physically moved. So both of us were not.
Can I clarify, was she moved and then she came back?
No, they took her things away. She doesn't have clothes. They moved the boxes.
She
packed
has
the
stayed
boxes.
there with the few boxes.
Yeah.
Is there a third party that could perform some sort of informal canvas of a?
Maybe we ask legal aid or attorney general's office to do this, so we get the real, because also with the directory being erased, that's a problem. Travis and then.
Excuse me, Roberta, would it be,
So
for the letter, the stats, building, I was thinking, how many units are still occupied per building?
Yeah.
Yes.
Yeah, I mean, it could also just be a list of every unit in the building and whether or not.
It's vacant or
occupied.
occupied, right, yeah, but just a broad thing, right?
Yeah.
Because there's like, people assigned, they haven't moved, like,
Yes.
okay, fine, that's notes, but how many people are there? And it was 7, it's not 7. Travis? And then
How
Vera.
soon can it be easily arranged with the elected officials and?
They're all in Puerto Rico.
Regarding this.
Yeah, everyone is at Somos.
If I-
And so, the reason I have been engaging with the various staff members, because the principals are in Somos. But I think we're really talking, given it's Thursday, it's probably gonna be early next week. But I think getting something, a letter quickly drafted about these points, getting it out there helps a meeting to happen early next week.
And I'd like to point out, for the record, that the story being told about the son signing something, that story was a narrative that has repeatedly come up in our conversations in the months, years now, leading up to today. And so, in addition to all the other stuff that the AG's office is looking into, there should be some insights or investigation done regarding fraud. Because there's a lot happening here, and the stories are consistent. I just wanna.
There's always gonna be, we're dealing with the human condition, right? There's all the different stories that happen with people. And that's why the normal process for relocation like this in the standard pact conversion takes 6 to 8 months. And this has been reported to us by legal aid and by NYCHA. The acceleration here is the problem. Here,
Also, we have several people,
Oh.
Nelly texted me.
oh, sorry.
Yeah,
Gotcha.
some of them I don't even do.
But just a point, I mean, I'm sorry.
Wait, I'll just get a committee member first, Vera.
We let other people talk a little bit, also on the committee, I'll just make a quick suggestion. Typically, when there's a NYCHA that moves, there are protocols, and they actually have a vehicle. Basically from legal aid. Residents to communicate between the
Correct,
parts.
right.
So is there any protocol in place? Are there any people who've been assigned to actually have the communication part in a very, very clear way? Whether it comes from legal aid, or it comes through NYCHA. But there has to be somebody there who actually is able to go between. I think you should include that. If they haven't done that, they must be doing so very.
Oh, we gotta ask them to follow their standard procedure with PACT. It's
Looks
not,
like standard procedure is not, it's not.
no, this is not the standard procedure.
They're not following.
They're not following it. They have a whole series of real rules of this. By the way, it doesn't work so easy. There's gonna be problems. That's just the nature of it,
Just the nature of the family.
you know.
That's a great.
JD, right?
I was just saying, Baron's idea is a great idea.
JD,
Yeah, I think the letter is fine, but I don't think the letter is going to be
enough.
that quick. And people may still be harassed tomorrow. I can call the precinct commander of Midtown North and tell him something. Jesse can talk to the commander of that precinct tomorrow.
Yes.
Say, we have a problem. The lieutenant, there's gonna be a problem. She needs to be informed that this building has not been sold. We can do that tomorrow.
Yes, we can.
And I think we should, along with the letter, as quickly as possible, and I would ask Quentin, please talk to HOU or
Yes.
whoever these people are. Please tell Eric tonight or tomorrow morning, you can text him, Puerto Rico, wherever he is, and say, this is a big issue. They've got to stop now.
Thank you.
And it doesn't mean
And
that,
then the letter can go, but we're not gonna get a response to the letter tomorrow.
one of the things that,
So we can do both.
yeah, I conferred with Carl back and forth. He said, well, what would you normally do? I said, if there's a dispute, what you normally do is you stop. And then you have a discussion and you deal with it in the light of day. You don't continue to pressure somebody or say, you don't get to talk to your neighbor can't talk to you. Like that's a crazy land thing.
Can we do other committee members and then move on to other CB4 members? I see Josephine wanted to speak and David Warren.
Liam, anything on this? Pete?
I'm very familiar with how these react situations such as this. So it hurts. It leaves scars. These are seniors. And it's very traumatic.
And the police are authority. That's the problem.
Yeah, they.
Katie, anything? Savage? No Savage.
No.
Okay, online then, let's go to, David Warren, community board member,
And then Josephine.
and then Josephine, community board member.
Hi, good evening. First of all, Joe and Maria, thank you for running a great committee. I know it's very tough and also thank Lydia and Lizette and John for their great effort that they're doing. Just one quick suggestion, I don't know if this is appropriate or not, it might be inappropriate, is maybe we can file a report with the NYPD Civilian Complaint Review Board, because it was mentioned that the officers were extremely rude to the people who were helping this person out. So I think that would have maintain a record also with the police.
David, just for your information, that was already done.
Okay, thank you so much, and I appreciate your time tonight.
Josephine.
Hi, everyone. I just wanted to flag also that the AG's office had said that they are trying to get, the developers are trying to get everyone to sign, go from Section 9 to Section 8 project-based voucher. They're trying to get everyone to sign by December 1st, or they said that they will have to pay the contract rate. And that's another issue, because people are feeling that even though they did not agree to this, that they're feeling that they're pressured, that they have to sign.
Which is market rent.
Yes, right. So my question to you really is that, I mean, I suppose that's legal because they're doing it. But what would you tell people to do? Because if someone is fearing that they're going to have to pay market rate in December unless they sign, but meanwhile, they do not agree with this demolition or this project, what are they to do?
Nobody has to pay market rent in December. That is a falsehood. This is a whole process to do conversion, and it takes time, and it's not gonna happen until there's a closing. And that closing has to happen when the finance is in place. That is the sequence of events.
All right, so is that going to be could that be something somewhere in the letter? Because this is actually what they're telling people that they have to do. They said that they need to get 85 to 90% signatures by December 1st, and they were pushing this. And so maybe this should be somewhere in the letter.
Yeah, I think we could put like a sentence in there that just says that's not how the process works, and there's no December 1st deadline.
Yeah, right, exactly, yes.
Right, and the know your rights thing, right? Katie?
Exactly, no, I think we're all agreeing with each other that should, Josephine, that we're saying that, yes, that's a really good idea or good point, and we should make sure that that's in the sort of know your rights thing that's gonna be presented to the tenants. But somebody really has to be making sure that everybody understands that.
Thank you. Thank you. And also to your question, Katie, earlier you were saying that you wanted somebody to be there, and they said that the developer said that the trailer that is right next to PS 33 is actually their staff members who are answering questions for all the tenants. But as we know, that's not really helping. But my point is that they may say that that's what they have there, because apparently that's what they're doing. That's their answer to this.
But I think we're asking for some third party that is not paid by the developer or NYCHA to say legal assistance, whatever, here's what you're writing.
Great, thank you.
Right, Katie?
Somebody from a legal organization.
Right, like totally separate, right? Layla, identify yourself, please. Layla, identify yourself, please. You're on mute.
Hi, good evening. I'm Layla Logizico. I am the Democratic District Leader representing Chelsea. Thank you for the opportunity to speak. Thank you for the work of the committee. I really, really appreciate that you're taking this issue seriously. I was actually present at the building on both days, Wednesday and Thursday, when these occupancies happened. I witnessed what happened. I concur with the statements that were made. I just want to flag a number of things for the committee. One of them is that in the master development agreement that was signed between NYCHA and assets and related developers, it is stated that the buildings need to be delivered vacant in order to close the transaction. And I think that may be one of the reasons why there's this urge and this rush by the developers. The question, though, is how can this contract be enforced other than by the two parties? It looks like NYCHA is actually very comfortable with the misdeeds of HOU and related. So the question that maybe
Layla, I'm interrupting you because We're all in the room having trouble hearing you.
You're
Oh.
breaking up a lot.
Uh,
You're breaking up
is
significantly.
is that better?
Yes, yes. So
Okay,
can you
I'm
just
gonna.
can you make it concise, please?
Yes.
Okay, my question, my comment, generally speaking, is I was in attendance at the building on Wednesday and Thursday. I witnessed what was described, and I concur entirely with what was described, and it is consistent with what I observed. The one thing that I want to mention and flag for you is that in the master development agreement, it is mentioned that the buildings must be delivered vacant in order for the transaction to close. And I think this is the reason why there is these tactics are being used so that they can close on the transaction. If the buildings are not vacant, the contract prohibits the closing. And my question to you, and something that the committee and the board may want to explore, is how can this contract be enforced by someone other than the contractors and the contracting parties? Because right now the contracting parties are NYCHA and Related Essence, and they're both perfectly content with what's going on, unfortunately. And is there a way for the community board to ask the Attorney General's office to play the role of enforcer so that the terms of the contract can be challenged so that the tenants don't have to suffer the consequences?
I don't know if we can get into this broad thing. I think the issue we have here that we want to focus on is that irrespective of what anybody wants to happen with this project, this is not the way to make it happen. We have common ground on that. Am I getting a sense here? Am I getting a sense to everybody? This is not the way, right? And that's the thing that enables us to do an administrative emergency letter, because it's just, I've never heard of this before, especially not in a NYCHA building, right?
Yeah, I was just concerned about the timing.
Right.
Yes.
Right. So, Kate, I want to say that we're trying to figure out how to get to an end here. Rhea, can you just do the recap of the points of the letter?
So I have, an immediate letter to the AG's office, Legal Aid Society, and our local electeds, including Nadler. That we want a monitor, a legal advocate that is a third party in the building every day that's informing tenants of their rights. We want to know, or, not to know, I would say we want to advocate to have someone informing the police of what the facts are.
Yes.
The judicial process explained to the tenants. That Lisette that you mentioned is currently happening, and.
Well, no, that's a legal action about the overall project. But
Oh, that's right, I'm sorry.
we want to explain to the tenants how the legal process works
Yeah.
for the relocation, notice,
Yes.
NYCHA, administrative action. There's a whole,
Yes,
like 17 steps.
That's
before
right,
you-
we heard some of.
Nobody could say to you, you gotta, no housing for you. It doesn't work that way.
No.
And maybe just a suggestion about the language in the letter is to say, we think that there should be somebody in the building every day. If that's not possible, at a minimum, there needs to be somebody in the building on the days when there are going to be possible visitors. Right, that there needs to be a third party present.
Right. Yeah, how I phrase it is that someone could have misunderstood or not understood at all. And someone could change their mind. It doesn't matter.
I would say that really what we need to put is the monitor legal advocate, having a minimum that what you are suggesting is possible. Especially if there's political will. And that's what we can advocate for, and that's, I believe, for the tenants, that's what we need to advocate for, not the bare minimum. Okay, so I'm going to say that we strike out the minimum possible part. Roberta, what I have for you was included in the letter was the stats for the building and the units that are vacant and occupied. And someone mentioned a sentence about process. Being presented. Was that you?
Procedure and protocol, that includes sort of legally,
Did you say something else about giving the residents some sort of flyer or something they can refer to?
Yeah,
Yeah.
in addition to the.
Like a fact sheet kind of thing.
Yeah.
Made those.
Yeah.
Okay, and that was all that I have. Did I miss anything?
That the lawyer should draft up the fact sheet, and I know you're right, saying, and it's. Our
It sounds like-
Legal aid or they.
It sounds like I already have that.
We made mention of it, explaining the next.
Right, but maybe it should just be something from the AG's office, so it's the outside party.
All right, so we got clarity on that, and
Cool, everybody, hold on for a second.
There was one concern about enforcement from the crowd, like how's any of this, how it's, any of this going to be enforced.
Oh, yeah.
So where do we fall there?
I just want to say that.
our electeds, but we need to vote on the letter.
No, but before you do that.
Okay, good.
There's something.
It doesn't matter how many papers you give to the tenants, they already have the rights, they already know the laws. The problem here is enforcement.
Yeah.
Who is going to stand for them? They know the rights, they know the process.
Well, not everybody knows their rights.
No, they do. Believe me, in the senior building, you should go and interview each one of them in Mandarin or Cantonese or Spanish or Russian, whoever is left. They know their rights, but that's why it's beyond frustration. It's anger. It's just like outrageous. And this is outrageous what we are allowing to happen to the team.
Thank you.
That's it. So I'm just saying, Maria, or you can say, don't give us no more papers. Find out the way to hold, whoever is responsible, you have to hold them accountable. Whoever is responsible.
That's what we're trying to do today. And the thing of it is, we know that we are the only public spot
Yes.
where people can come and speak and talk about this. And our electeds are slowly trying to understand, to come together to say, there are lines in the sand here. Even if you support a project, there's a line in the sand how you do it. So is there given Maria read the bullets, right?
Yes, I did.
Is there a,
Motion to write such letter, yes.
yes, is there a second to that? Okay, all those in favor of getting this administrative letter out and also requesting the meeting with the police tomorrow by Jessica. All those in favor, please raise your hand.
Thank you.
All those against? All those abstaining?
Thank you, Barry.
No, Hector, you're Peony, right? Peony?
That was only for that letter that you guys discussed earlier. It's not for anything.
Can you send to him?
The
No,
one that
I'm
you
saying,
raised earlier. Not any on this one.
yeah, Peony, he said Peony.
No, I'm not P and E. You can check it, you can check it out. We'll discuss this later, but I'm not P and E.
Okay, so Hector, so your vote is no? Okay, so then we'll refer this to Jessica and Jesse to talk to the Borough President's office about, okay? Because that's a matter of, it's not a matter we deal with, it's a matter the Borough President deals with.
That's
Okay.
fine, let's do that.
Okay. Yes, John, I gotta tell you, we're at 8:58. And we have one more item on the agenda, and I just texted the presenter to say, do you still want to present? And the response was, I'm here, and I have a 7-year-old on my lap. So I have to say, so, John, we can't, because we have other things. Thank you very much for your time tonight. Thank you, ladies, very, very much. Thank you, Tam, very much. Thank
Just to
you.
let you know, Doris is elderly with lots of problems and she's near death if they keep pestering her.
Thank you. All right.
I'll give you more information.
So, Nellie, we should be joined by Sarah Levinson from L&M. And we're gonna try to make this presentation as painless as possible. I wanted to thank you so much for coming tonight.
I have only one. Can you unions in NYCHA stop the same to us? We are avoid the lease. We not avoid the lease.
Still having our meeting?
But they can do free, anybody, free ladies.
They're still having our.
To him, who works for the council.
Oh,
Okay, so we have, Nellie, do you have Sarah Levinson coming over?
No, she's not on, but you do have another topic on the agenda.
Which? Oh, the retirees, I'm sorry. Let's do, I apologize, Camille, let's do that quickly, go to it next. So, please state, Camille, in as concise a manner as you can, the issue with this, please, thank you. And thank you for waiting so long.
my heart goes out to those people, and Lizette Colon is a fellow retiree.
Yes.
I'm a member, well, first of all, thank you for having me on such a busy night. I'm a member of the New York City Organization of Public Service Retirees, and we're a grassroots organization of some 50,000 plus New York City retirees and some active workers. Since 2021, we've been fighting the city. And sadly, many of our own former unions who no longer even represent us for the healthcare we were promised in our retirement, and that we earn traditional Medicare plus a supplemental plan at little to no cost. They want to force us into a for-profit Medicare Advantage plan in order to pay back $1 billion taken from the Health Insurance Stabilization Fund in 2014 and 2018. The funds were used for raises instead of offsetting increases in healthcare costs, which is the purpose of that fund. I'll just skip to, there is funding for our healthcare in the city budget. It's been a line item in the budget since 1967. It costs less than 0.6% of the city budget. A little bit about Medicare Advantage. It's the default healthcare plan for seniors in Project 2025. As you know, these plans delay and deny care. They have limited networks. They overcharge taxpayers by a minimum of $88 billion per year, up to $140 billion a year. They also do something called upcoding, which is making you seem sicker than you really are in order to charge the federal government more. They also use artificial intelligence to review claims. We've been fighting this battle with litigation and legislation. We've won 11 unanimous victories in the courts. However, litigation is expensive and we have no guarantees the higher courts will support previous decisions. Our only setback was in the New York State Court of Appeals, which sent the case regarding the city's ability to force retirees into a Medicare Advantage plan back to the New York State Supreme Court. And that was in June, and Mayor Adams said, while he was still running for mayor, that he would not force retirees into a Medicare Advantage plan at this time. So far, he hasn't, but this illustrates the need for legislation. We also have a pending case regarding copays. New York City retirees were never charged copays until 2022, and that was initiated by the unions, not Emblem Health. We got an injunction to stop them because they're actually backdoor premiums. The city then renegotiated the contract with Emblem Health to charge copays beginning January 2025. And for some retirees, they are as much as a monthly car payment. And our lead plaintiff is a woman who taught business in a Queens high school for 40 years, who has $500 a month in copays. And she is presently forced to go to food pantries, and at age 73 has a part-time job. Our legislation. Last year, we had a city council bill to protect our healthcare, Intro 1099, and I'd like to thank Manhattan MCB4 for your support of that bill. Unfortunately, it never made it out of committee. So some months ago, council members Chris Marte and Robert Holden introduced another bill, Intro 1096, to preserve our health care. This would codify our health care once and for all. I also just want to say that Medicare was started so that all seniors in the US would have equal health care. It was really a civil rights achievement. I'm asking this committee to please vote in favor of a resolution or letter of support for Intro 1096, and then taking that to the entire board for a vote. Right now, we have 18 council members who've signed on. Both Eric Botcher and Gail Brewer have signed on, but a letter of support would reinforce their decision to co-sponsor our bill. Unfortunately, Speaker Adams has not brought either of our bills to the floor for a vote, so a letter of support to her would also be a good thing. Your endorsement will strengthen our position immensely, and also you're a conduit for information. If you support us, please let your elected officials know. I hope you will vote to pass a resolution or write a letter of support endorsing our bill. 250,000 lives depend on it. Our website is nycretirees.org. We're on Facebook, Instagram, YouTube, X, and TikTok. Thank you very much.
Thank you.
And I hope you got our information sheet with Medicare Advantage and a fact sheet on the bill, Intro 1096. I sent it to Nellie and she said she would send it to you, but if not, I'll send it again. Thanks so
We
much.
received it. We received it. Katie Stokes.
So, thank you, Camille. We, got a presentation from Betty, one of our former members,
Yes.
about this.
Right.
The previous legislation. I'm the one who wrote the letter, and it was passed and we sent it in. And so I move that I update that letter to now have it be about Intro 1096.
Thank you.
And that we submit it to the committee.
And we should also note that come January, there's a new speaker, so we have to take action again. Because this Speaker Adams is out the door in like 7 weeks. So-
But it still works.
Oh, no, I'm saying we take action again as well. Is there a sec to that?
That's not a second. I have a.
Oh, question, yes.
No, it's not a question. So
Oh.
I support the aims of the bill. I think I brought this up the last time. There is like a very meaningful crisis within the funding of the city's healthcare stabilization fund. And it is negatively affecting or could negatively affect, if the courts do not uphold this, the status of retirees. But what it is also doing is negatively affecting the availability and quality of care of present employees. And I would just express that like these things are connected. It is why DC 37 has, I think, come out really like in opposition of this piece of legislation. And I understand that what I'm saying may make people upset, but there is an element of this that like needs to, I guess, it would be helpful to also state that in addition to supporting the continued, the healthcare that retirees work for and were promised, that it not come at the expense of existing employees who we are having difficulty retaining and attracting into city service, and who are frankly, being faced, having been one fairly recently, with frankly, some really like embarrassing healthcare options.
So,
Wait,
Yeah.
sorry, can I just ask a clarification there? So, sorry, Roberta, so are you suggesting that the letter would say we support the passage of Intro 1096 unless the cost of it would jeopardize current?
Not going to.
No, that is not what I am suggesting. I am just suggesting that there be some sort of context put in here, because I believe that like everybody supports the ends of this legislation. It would be crazy to not support the ends of this legislation. But there is an additional context that I feel like is being, it like isn't like a part of this discussion that I think may have adverse impacts for current city employees. And I think that should be recognized and stated that we also do not support that.
So we use the phrase at the same time,
Yes,
we deal with this concern.
yes.
I think it is not, if they say it's an unless, one of the things that is,
It is not
that we
an unless.
litigated 100% last time in this thing, I know, so I'm trying to help you.
Yeah, you're saying.
Right, because the idea that
At the same time, we also support the
Yeah.
the provision of
adequate funding, right,
medical,
right.
insurance to current employees.
Yeah, so,
Is that right?
Viren, not a committee.
Same question, but I think you answered it now.
Yeah, so,
Two are not in conflict. If I can just clarify.
yes.
May I just say something, please?
Hold on, Camille, I got committee members, stop talking please with each other, and Kevin's next.
I was just discussing quickly, if you disagree, perhaps the language could say this should not be at the expense of funding of employee wage increases and contributions to employee benefits.
Can you?
Yeah, I can.
I don't think that.
I have to say that one of the problems we had here, we're having the same conversation last time, is that you worked for the city, you got commitments, and that's it. Now, the city has to figure out everything else. And I think by saying at the same time, it makes the compromise here, because when you start to talk about not at the expense of increases, you are, I hate the idea of pitting two classes of city employees against each other. And that's what it is. If the city doesn't, if the politics get worked through, And there's a new mayor who realizes you must help the people who were there and not welch on their promises, and you must help the people who are there today.
Yeah, exactly.
And by the way, here we are in Chelsea NYCHA, basically, right? They're trying to help everybody in the future, but what about people who are there today? It really creates a tension that we should not. And I know,
Want to hear, but I
Right.
think you
Right.
want to.
Yes,
that
I agree.
those two
So that
things
we
have to-
support our past and we support our current.
that's right, right. And that's how we figured it out the last time.
Yeah.
To get everybody in the same boat. Okay, so wait, you're not a committee member. So we got through that, and now we have lost.
Hold on, we have
So
one
may-
more.
sorry. All those in favor of that motion as stated? It's a restatement of the support from before, and then we're putting in the sentence about at the same time. All those opposed? All those abstaining? All those peeing?
On a non-presidential basis, I'll vote D&E.
Peeing, right.
Hector?
Kevin on the past, yes, worked, yeah. Hector? Are you voting on this one?
Let him sleep.
All right, well.
Okay.
catch him later.
We'll catch him later and double check. Now, we are going to another project, and it is 9/11, right? Right.
Oh, thanks.
Okay, I said yes. I put my thumbs up on that, okay?
Oh, no, your camera was off. Your camera's off. Got it. Thank you. So, this is Camille, anything else, Camille?
I just wanted to say that the Health Insurance Stabilization Fund is done. They wanted to destroy it, and they did.
Thank you. So we'll send a letter and you'll receive a copy of it.
And
So
thank you.
everyone, you're welcome. We have a presentation for something that our community always asks for, and it's shocking to get offered. And there's a few things to work through on this. The land use chairs and the co-chairs of housing got a briefing about 2 weeks ago on this. It is a series of buildings at 420 West 45th Street between 9th and 10th Avenues. And we have a proposal in front of us from L&M Development. Get ready, you're all sitting down, to do middle income housing at that location. We never hear about middle income housing, and we're gonna get a proposal here about middle income housing. And the ask is getting a tax exemption, an Article 11 tax exemption to support this project. Sarah, we thank you for waiting so long. And you're very brave after these two items to talk at all. If you introduce yourself, tell us who you are. And by the way, I just want to note, Sarah. Yes. Oh, you're not Kylie Antigua.
I'm not, but that's okay. I'm here and I'm, channeling Kayla tonight, but I'm Sarah. Yes.
So Sarah Levinson was formerly, many years ago, an employee at HPD and came in front of this committee many times to present inclusionary housing projects. And that's how this board is very familiar with her. Who are you today? Where are you? And describe the project.
Sure. Well, you did a great job teeing me up. I'm Sarah Levinson. I'm a managing director at L&M Development Partners. And as Joe mentioned, I started my career at HPD really cutting my teeth actually on some very complicated projects in Community Board 4. I think we did the West 52nd Street home ownership project together. We crafted what was formerly known as Studio City and now Gotham West together. So it's really exciting and kind of a full circle moment for me to be back here today, but also to propose a project that is directly in response to the July 2025 affordable housing plan that was crafted by Community Board 4. Joe, should I share my screen? Does that work?
Yes.
Or I know I sent a presentation to Nellie.
You can share your screen probably because we can then
Okay.
we can move easier.
Okay, sounds good. This is a very short proposal. I know it's late, so thank you guys for bearing with me. Let's see. Can you see my screen?
It's coming up now.
Okay,
Yeah.
awesome. So as I mentioned, or as Joe mentioned, the project is the redevelopment of 420 West 45th Street. It is a 100-year-old building located between 9th and 10th Avenues in the Special Clinton District within the preservation area. It was originally a factory. It was repositioned as an office building that is predominantly vacant at this point and will be completely vacant by the beginning of 2026. What we're proposing to do here is redevelop the site to develop 51 homeownership units. 2/3 of them would be affordable to middle income households. And our anticipated delivery date would be in 2028. As I think we had mentioned, we are looking for an Article 11 tax exemption here. What's super unique about this execution is we are trying to do this without HPD subsidy. So really only leveraging the Article 11 to produce the middle income housing units. Let me see if I can go to the next slide. Is it advancing on your end?
Yes, yes.
Okay, great. So this is a little bit of a look of the income mix. As I mentioned, 2/3 affordable to 145, 155, 145 to 155% AMI. There are no studio units in this project, and we have over 50% for family-sized units as well. Looking at the design of the building, this is an as-of-right project. We are not looking for any discretionary actions here to execute, so we were staying within the 75-foot height cap. We're looking to really recreate the red brick that currently exists on the site by matching brick and mortar colors. And, I had a really great conversation with Joe and Maria, just generally speaking about, the facade and the context here. And we are looking to design a facade that is within the vernacular of the street, but also the block, and really focusing on a loft style building here. We understand that there's something super cool about the site, and that the Tootsie Roll was actually invented here.
It's the Tootsie Roll factory, folks.
It's so crazy. It's just so crazy. So
Keep
what
going,
sorry, no, it's hard. It's hard for me to hear in the background. But we're attempting to include a plaque right at the entryway of the door to commemorate this site and what occurred here in Candy history and lore. We have a lot of historic photos of the old building, which we're going to be leveraging as part of our interior design in the common areas, and then really focusing on the original factory materiality to inform our not just exterior, but also interior design selections. And just some other highlights and how this project is a direct response to the July 25 Affordable Housing Plan. As I mentioned, the provision of the middle income homeownership units, which provide long-term stability and affordability. This is again as of right and contextual in height and bulk. You are getting that missing middle that we talk about that really was an unmet part of the market that is not met by the inclusionary housing program or really by any of HPD's loan programs at the moment. And we have those family size units that are also being provided. I think also most importantly, there's parity throughout this building. So there's the continuity of finishes, distribution of units throughout the floors, and all of the amenity spaces are accessible to all. Again, this is also an all-electric building, looking towards energy efficiency and sustainability and moving off gas. And again, this is a no HPD subsidy project, which really unfetters us from the HPD time constraints as it relates to competing for pipeline position. And we would be able to deliver this project relatively quickly in 2028, which I think, Joe, is pretty lightning fast for a CB4 execution.
All I can say is we're still waiting for the slaughterhouse on 39th and 11th. Yes.
So yeah, that's my small presentation.
So one of the things that in the briefing meetings we had, we're asking the developer to come back to, and we'll share with the committee, with an actual facade treatment, because the thing that was presented was sort of like anywhere in West Chelsea, big windows as opposed to trying to fit in this block. And they said they would come back and we'll share it prior to our December meeting, so we can all comment on it and give input on that. The things that we haven't had, two questions we haven't touched. This is an affordable HDFC co-op. And could you just explain how you're doing this skewing of the maintenance and all this stuff to make everything work?
Sure. So you're talking about sizing the sales prices?
Right, because of the market, like,
yes.
What are the market rate going to be going for, and then what are the affordable going for?
Okay, so on the I like your scale. So on the affordable side for one bedrooms are about $600 to $680,000. On the two bedrooms, it's around 715 to 770. The three bedrooms are between 8 and 900,000.
So could you
And
also, Sarah, because people are passing out in the room, could you note what the income bands are for those things too?
yes,
'Cause think
I
that's
can do
another
that.
concern.
I can do that. So the 145% AMI in 2025 for a family of four is $234,900.
So
150. Go ahead.
239,000 for a family of four. So that's why those prices are affordable to that income band. Our income bands in our, that are used by HPD have gone up so dramatically that's why.
We're affordable.
Yeah.
They keep using the word affordable.
Well, no, but actually, John, if you take 30% of your income, you can afford, and you make that higher amount, but you can't afford the market. You cannot get a 3-bedroom apartment for $700,000 anyway, period. It's not gonna happen here in Manhattan. Right, so go ahead, Sarah, sorry.
No, sure. So the one for a family of four, 150% AMI is about 243,000, and 155% AMI is about 251 $1,000 for a family of four.
And 10 years ago, that was half. That was half.
Sign me up.
The salaries are still.
No, these salaries are higher. These salaries are higher. Yeah. Sarah, can you talk to us a little bit quickly about affordability restrictions, permanence, and resale restrictions? Does everyone understand this? The new members of the committee, right?
Same, like.
Yes, this will be subject to lottery, right?
Yes, it will be subject to a
lottery.
lottery. Absolutely.
Thank you very much for coming, folks. Go ahead.
I think on the affordability restrictions, the Article 11 comes with a 40-year tax exemption. So that will keep the units affordable for 40 years. Upon, I think, year 38, we're probably going to write into the Deccan bylaws that the co-op go and try to reapply and have the council extend that Article 11 or apply for a new one to build in extra long-term affordability and have those requirements built in up front. I think it's interesting here from a resale perspective.
Go ahead, sorry.
No, it's okay. On a resale perspective, in order to remain in compliance with the Article 11 exemption, you must have 2/3 of your units at all times affordable to households at 165% AMI or below. So that will always be the case when you have a resale. You would have to have those tenants income qualify or those households income qualify. And we would be partnering with a monitor to ensure that not only the initial the initial sales and marketing are in compliance with the Article 11 guidelines, that all resales would be as well.
So can I just note that this committee has confronted this issue before about going beyond the 40 years. And one of the ways it was managed in a project that you're familiar with, 540 West 53rd Street, is the affordability restriction there is like, I think it's 65 or 70 years, right? And that will give great help to the owner to then get their tax exemption extended. So we're gonna make that recommendation because that was a big issue, because it seems 40 years is it's forever, except if you're in the Penn South and it's yesterday. So we really want to make sure that nobody gets the benefit of these tax exemptions and then cashes in and the project becomes unaffordable. And the city has done this before, and it's a mechanism that helps, right? Because if there's an issue, we can't extend it, it allows the owners to go, you're not helping me, how can I do this? And that pushes the affordability down the road.
So we can't, I don't know how this works, but so we can't ask for it to be permanently affordable?
We try to go to, answer is yes. And that is what inclusionary does. And we tried to figure out how to do it when it's not inclusionary, and that was a solution to put across the country when they have tax exemptions, right, or taxes or bonds, it's 60, 70, 80 years. That's standard across the country. On our city, no. So this starts to push that envelope. And Sarah, we would certainly work with you to understand how to embody that kind of language. Cause that's two full generations, of trying to make it stay affordable. Because trust me, who knows where we are in 40 years? Someone could get an idea. I bought an apartment for $700,000. I can sell it for 3 million. You shouldn't benefit off the public treasury on that. Right.
Yeah, I mean, I think that that's right, and it's something that we are exploring on other homeownership
And then
projects
what
that
else,
we
and
currently
can
have in
you
place.
detail for us, if you don't know now, before we write our letter, your resale restrictions about the sort of like, what are we captured to make sure the co-op survives, like flip taxes, things like that, so long-term stays affordable.
Yeah, we can definitely give you some more information on our resale. I think the interesting thing is that since we are attempting to execute this without the HPD open door program, we're hoping to have a little bit more flexibility on what the resale restrictions are and able to customize them a little bit more. That is still open to negotiation with HPD as we discuss the Article 11 moving forward. But I think there's always a really interesting balance here because you want to have that wealth building, equity growth, and upward mobility, and not just have kind of like a limited equity co-op or almost like what I think Joe used to call it almost like a glorified rental. You really want people to grow and have some sort of equity, but at the same time, you don't necessarily want a windfall at the other side. You want to have a balance. And so I think that's what we're going to be looking to strike here, so that there could be people see an appreciation on resale, but not all the way up to, a market level, so to speak. And I think that
Similar
is,
to how the inclusionary housing ownership works.
yes,
right?
similar.
Katie.
Curiosity, the sales prices you gave us were for the affordable units. What are the prices for the market rate?
Sure. So I think market rate is anywhere, I think for 1 bedrooms are probably in the $2.4 million range. And 2 bedrooms, depending, are anywhere from 1.4 to 1.8.
You said 2.4 for 1 bedroom. That's the other
I
way
said
around, right?
I said 1.2 for 1
Oh,
bedroom.
no, we heard 2.4, that's what we asked out.
Oh, no, there's no 2.4 at all. Not at all.
Right, so, and again, the whole idea of this, everybody, the whole idea of this is that it's cross subsidy.
Yes.
That the market rate subsidizes the affordability, so you get this mixed building, but everyone's living in the same building.
And how are you purchasing that at all? How are you purchasing? Like you borrow, like.
A mortgage.
A regular traditional mortgage,
yeah.
mortgage
Yes,
rate,
well,
paying regular bank.
yes, and
The maintenance lower.
Sarah, is the maintenance equivalent, how's that work?
So it's really interesting how you size affordable home ownership sales prices, but it's very similar to what you're going to see in a rental with your rent burden or your household factors should really not be more than 33% of your income or of your overall expenses. So what you do on affordable home ownership is you look at the operating expenses of the building, and you are basically on a pro rata share on co-op shares, assigning carry to that. And it depends on the size of your unit, generally speaking. And what you do is you back into a mortgage after that. So really the affordable units, all in, including, there won't be any real estate tax carry here, but all of the M&O expense and your mortgage won't be more than 33% of your overall.
So, Sarah, is everyone paying the same maintenance in this building?
No, so the market rate will be paying a higher rate, again, to your point about the cross subsidy. And then also there's usually a differentiation in the different sizes of units as well.
One last thing, I'm sorry.
This is.
And if you have to assess a local 11 project in the roof or something, is everybody equally assessed, or is it like, how do you handle assessments?
It would also, that's an interesting question. I think we've done it a number of ways in the inclusionary days. I think we need to look at it with a little bit more granularity here, but it is going to be sized on based on your pro rata share. So there's going to be the market rate units are larger, and again, market rate, so they're going to have more shares and more carry than compared to the affordable.
Per share.
Yeah,
Whatever shares you have, whatever it is.
And that's very important, because we don't want somebody to be priced out down the road because of some special assessment, because there's a boiler or facade to be replaced. So yeah, you never know what's gonna happen, right?
Sorry,
Katie,
Sarah, just to the point that you just made, when you said that the market rate apartments will be larger than the affordable apartments. Can you say a little bit more about that? Do you mean that like the market rate one bedrooms will be bigger than the affordable one bedroom apartments?
Not necessarily. I think on some of the market rate apartments to maximize marketability, because again, you really need the market rate sales prices to make this all work at the end of the day. There's some of the market rate units that might have a larger outdoor terrace or some additional, like an office space, so to speak, because on the market rate side, you're selling and absorbing on a per square foot basis, where the affordable units, really at the end of the day, you are capped by that 33% based on the AMI. So you don't have as much flexibility on sales prices. I think we're trying to have as much parity on size as we possibly can, but there are, because it's a small building, but there are some market rate units that will command a higher price and a little bit higher of a carry at the end of the day, because they might have some more outdoor space or a little bit larger.
All right, but then so I'm sure you know this, but it's important to us on our community board that like the finishes are all the same and, they all look the same basically.
Yep.
So that would still be the case.
Yes.
and they would be distributed throughout, right?
Yes.
Right.
Yes. So the
Yeah,
finished package is 100% the same, no matter what. I believe right now we have some middle income units actually on the penthouse floor, which you don't get in inclusionary projects. The amenity spaces are open to all homeowners in the building.
Okay, thank you.
Pete?
Yes, will the homeowners be required to live there, the entire year?
Oh, that's
Yeah.
really interesting.
Owner occupants, Article 11.
Yes, that is 100% correct. You do have
flows
to
from the
have it
law.
as your primary residence.
He asked, so the Article 11 must be owner occupants. Pete said, what about the market rate?
That's a really interesting question. I have to be perfectly honest, haven't gotten into that level of nuance yet. I'm being honest, guys. I love these questions. But it's something that we would have to look into because it is a parity issue. I think there's a marketing issue that we have to be mindful of, again, to Joe's point about the cross subsidy. But again, if you're not able to sublease your affordable unit, it does create a little bit of friction in the building if a market rate homeowner can sublease theirs.
And it also creates a problem that a community develops in a building, market rate and otherwise, and people want to live there with their families, not make money off it. It's the whole idea of keeping the middle income and market rate in the neighborhood is a larger units.
And that's one of my concerns. You find out that some of these units are across our community, they're being rented out to organizations such as Airbnb. And I think this is an avenue which is, of course, it's illegal, but it's being done. And I'm afraid some of these units are going to be purchased by individuals who are interested in use.
I think they have to be owner occupants because, and that is the Article 11 funds the thing. But I want to say, Sarah, that I want to tick, if anyone has anything left to mention on this, I want to tick up.
No, that last thing about the owner.
Brian?
I think it's an amazing project and
Right.
like how exciting for that neighborhood that this is happening. I think it's a great thing. I wish we had the ability to like talk to you about making it larger or bigger so more people have the opportunity.
Right, but the truth of it is,
It's a really cool thing.
if the model works, it can be replicated. That's the important part.
Joe just took the words right out of my mouth, actually. This is a pilot program that we're doing first.
Never been done, so.
Never been done. This is not the first time I've done things for the first time with Joe, but this has never been done before. And to your point, we're really hoping that this could be a model project that can be replicated not only in this neighborhood, but throughout the city. This is definitely something that's missing.
JD.
From the land use committee perspective, I agree with you. We were very much in favor of the project because the idea of the special district is to have a range of income. And so this helps that. Also, the design, thank you for that, for listening to us. As to being higher, no, it's in the special district and there are higher limits.
But that doesn't mean if it works, you can't come back someplace else and do it in a bulkier project. Vert.
This fantastic project, really appreciate the presentation. In theory, if there's a point with the, I guess, the marketing of the units, both affordable and market rate, is there and there aren't enough sales, is there the ability within the context of the Article 11 to go rental, like what you're seeing, and at least I'm seeing in some of the condo market, is that some of the projects are sort of that are kind of going rental.
On the affordable side?
On the affordable side, I think they were always rentals. But I don't know.
No,
I don't,
oh, I see, I know,
this is like a unique project.
right.
It's a weird, like, ownership market. I mean, it's a weird housing market, but like, there's some, I don't know, it seems like there's some softness, so I'm just curious, is there the chance that this doesn't work? And if it doesn't work, what happens? And maybe this is not something contemplated because it's.
That's the development question that's kind of existential in general, right?
It is, and we do spend a lot of time on our homeownership projects, working in a lot of belts and suspenders on risk. I think, from an absorption standpoint, the homeownership on the affordable side, I think, you're going to see thousands and thousands and thousands of applicants. And I don't think that there's going to be any issue absorbing those, and that's 2/3 of the units. I think on the market rate side, we are spending a lot of time focusing on what the product is in the market, marketability, absorption rates, and also pricing them a little bit below market to help with that velocity of sale.
So you will be coming back to us with more details and stuff, but we're gonna talk about how we can act tonight. So first, in general, I'm getting the sense that the concept of the project makes sense, yes? Getting a sense on that, right? That they're gonna come back to us. We're gonna bring in our letter issue of a longer term regulatory agreement to promote longer term affordability, even though the SAC exemption is 40 years. We're going to ask them to detail their resale restrictions, which will make it, and have that balance between gaining equity versus avoiding windfall profits. The special assessments allocation, thank you, Matt, on that one. That's an important thing that's important. It could screw somebody going forward. You will come back. Do you have layouts already to show, or?
We're working through them, but as we tweak the facade, there might be some changes. We're in very early schematic at this point.
Okay, so you'll send us, we have the detail of the distribution of the types of units and whatever, and your committee to come back, show us the layouts and go through that process with us as you go forward, right? The amenity is the same thing, because we always like to understand what the exact amenity package is and really what it deals with. The sublet issue, we think you're gonna come back to us with this question raised about the sublets. We want a community to develop there, not a business. And then you are definitely gonna, before our December meeting, send rough facade elevations, so we can send them to the committee and people can opine on that, so we can get something, so we have a good solid letter by the time we reach our December board meeting. Have I ticked off all the items there?
I hope
Yes?
somebody's taking notes. Someone's taking notes.
It's on YouTube. It's on YouTube.
Oh my goodness, we're on YouTube. Holy moly.
Yes. Somebody.
Ground floor.
Oh, yes, the use of the ground floor is residential, correct?
Yes, there's obviously a vestibule, an elevator lobby, and we have amenities in the cellar and then on the roof.
But there is no commercial on the ground floor.
No, there is no
correct?
commercial.
Anybody, I missed anything from the discussion? No. Okay, we are the survivors tonight to the end of this. It is 9:39. So is there a motion?
Somebody wanted to say something for 2 minutes for old and new business. Judy.
No, I'm on this motion of this item.
Sorry,
Okay, so on this item, which is approving an Article 11 tax exemption, right? To make the project work financially. And the whole thing we've heard before, all those in favor?
Joe, I'm sorry.
Yes.
Josephine has her hand raised.
It's not showing.
Oh,
on
no, no,
Facebook.
no, it's after this, Nellie, thank you.
Oh,
Oh,
okay.
okay, I'm sorry.
Thank you. All those in favor? All those opposed? Opposed, Hector? Oh, favor, okay, favor. Abstaining, Peony. Passes unanimously, Sarah. You're gonna have a big tall order to write something up and we encompass all this stuff, so we'll be coming back to you to make sure we get it right. And we want to send this to the committee at least when we go to the board committee, so we can get at it, because we're doing this at a really fast clip. Thank you. And now Maria, take it over.
Judy, really quickly, because she mentioned it to me, and then Josephine, Joanna, the other, but
Go ahead, Judy.
Yeah, just, you're a very impressive committee. I co-chaired a meeting on community virtually when you were not this good, so, you know, congratulations.
Judy, I'm thanking
We're impressive.
Trying to be nice to
Thank you.
Okay, so I'm attending here. I had a meeting of a board that I'm involved in, and I was charged $100 for renting the space for 2 hours. So I asked the manager of the building, there was community board 2 is using the space so often.
4.
If they are being charged,
This space, yes.
sorry. If they are being charged as well, and I was told no. And I just think that, and it's great that you're meeting here, it's fantastic the work you're doing. But the inequities of me as a tenant, fortunately, people take in, having to pay $100, and you guys meeting here very often, and the board not having to pay anything. To me, it's a real problem. And I don't know what you do with it.
I think you brought it up, and Maria can certainly manage this and bring it in a formal way to ask the question.
Okay, so we still have problems in the building. I'd love for you to come down to the basement with me and see the flooding that's there all the time. To me, it's a concern. I wonder, you know, if it's weakening the structure or however you call it, I don't know these things. But it is a concern. And I know Joe's gonna make a face when I say this. The front door is way too heavy. I don't know if you've tried it. I have a problem with my back, and every time I have to open the door, I hurt my back. I have asked for either automatic or something to be done to make the door not as heavy. And this is going on 3 or 4 years and it hasn't happened. So I wanted to say it to this committee, and.
the 3 things that you just mentioned, you can put it in email and send it to Jesse.
He's seen it from me a lot.
Yeah,
Yes,
like,
not the $100, but the others.
Every time, someone sends an email and it's for housing and human services, it's been forwarded to us. And that's how you can take action, so you can do that again.
Okay.
Okay.
Okay, we have met with Jesse.
Yeah, I've met with you guys too.
Yes,
years ago. I think he was in this building.
we did, and both, Eric Blanchard and Tony Simone actually set up meetings for us with Joe, so we have had some improvement.
Yeah.
But there was.
Like the numbers, the numbers outside.
There's finally, after 15 years, there was a number for that, yes.
And we're gonna go to.
Thank you. Yes, thank you.
We're gonna go to Josephine.
Thank you, Maria. So I learned today that the row, which has been used as one of the HERC facilities, is going to be closed as of December 31st. They were slated to be closed in April of 2026, but the closing has been moved up. So what this basically means is that families are being given notices that they have to leave the facility within 24 to 48 hours. They're given 2 garbage bags and a Metro card. There are DHF staff members on site, and they are giving families the option to go to a DHS shelter. The problem is that there are only 100 beds left in Manhattan. And so they could really end up in any borough. So I have been on the phone with the PTA and also our students and temporary housing manager at the DOE. And we are looking for ways that we can help these families. This is, families are, they've already, about 17 families have been, have had to leave the premises this week. Next week, it's 8 to 10 families every day. The week after that, it's going to be 20 to 25 families every day. They're just trying to clear the place out before December 31st, and they're not really giving a reason why this is happening in such an expedited way. So there are great concerns because ICE is all over the place. And these families are leaving the shelters with their garbage bags, and they have a week to come back and actually collect whatever remaining items that they have there. A lot of these families have infants. Some women are still pregnant. And so the school obviously is very concerned. 89 students from the row actually attend PS 51, which poses another very big problem, which we're going to discuss at ACES, but that is actually a quarter of the school's population. So this is a very big issue. The principal would like to keep as many students at the school as possible to give them some sort of continuity. And quite honestly, this is just disgraceful, the way that these families are being treated. We are talking about mental illness and homelessness, and this is where it begins, right? Because these families are just being treated so disrespectfully. So my question really is how do we deal with this issue? Maria and I have had a conversation today. And as I say, on Monday, the PTA will be at my meeting, at the ACES meeting, and as will Advocates for Children, to figure out other ways that we can help. But one of the things that I've been told that would be helpful is that if DHS would at least, if a family decides that they want to stay in a DHS shelter, then they'd be provided transportation in a DHS van to the new location. So at least they'll be safe from getting arrested, and they'll have some understanding of where they're going. I mean, they could be put anywhere in any location. And we have had experiences last year where families have said that they had a secured place in a DHS shelter somewhere and then gotten there and were told that, no, there are no beds here. So we want to avoid that as much as possible. And the families are also being moved, the day before Thanksgiving, the day Christmas Eve. And these are days when the DOE is closed. And these families are getting a lot of help from the DOE at the Welcome Center, where, they can be counseled and being told where to get other services. And so my question really is that I don't really, at this point, we're looking for ideas on how we can help these families. And I hope that my committee can come out with a letter, but I am reaching out to you all, first of all, to let you know what's going on. And secondly, to figure out if there's something that we can do.
So update, I spoke, her shelters are run by Health and Hospitals.
Yes.
And I spoke to Health and Hospitals today, and Josephine, I don't know if I gave you all of the update, but they said that the families are actually given about 3 weeks notice. I don't know if that's accurate. I know that I have a family currently that I'm working with. They were given notice for December 17th. They were also told it was closing, I can't recall when, February or January, but yes, now it's December 31st. Also, I think I do like the idea, the solution that you have regarding being transported to the next site that they are given beds at. And I think what we'd have to do is write a letter, advocate for it, because the normal kind of process would be the family would go to PATH, they would get Metro cards, and on their own, go to the next shelter they're supposed to be at. And PATH is like the intake center in the Bronx for families with children or families with adult children when they go into shelter. So that's the normal process. So I think we would have to be doing some letter advocacy.
And Josephine, we dealt with this before. That's why I'm kind of surprised. The 2 DHS shelters, the Skyline and the Travel Inn, they were closed for families and turned into COVID shelters. And in fact, DHS did manage it and did transport for that, because it's a facility, like the facility manager managed the transport in that case.
Yeah, so.
So I mean, I think that's a precedent we can cite for this. I mean, yes, this property may be closed down, but you have to do it in an orderly way. It feels certainly similar to the Chelsea NYCHA tenants of like, it's the thing that has to happen, maybe, but not the way to do it.
And I think the thing that's really concerning here is it's a shelter with families and children.
Right.
And the instability for the children. So if you're gonna relocate far away, which has happened to some of my clients before, and then having the challenges of getting to school, you know, that has impact on your emotional and mental well-being and how you do in school as well. But I saw Katie Savage has her hand up.
So I do wanna note that ICE did, do an operation at the row a couple weeks ago and picked up about 10 people.
Right.
So that is actively happening, and it was right around the time the school buses were coming and dropping off students. My question is, so last I was told, the Skyline Hotel and the WJ Hotel are both DHS mixed population shelters now. They're no longer migrant only shelters.
Sure.
Can we get an accounting from DHS of how many openings there are? Because I don't feel like I see the same number of people standing outside of the Skyline that used to be there. The same thing with the WJ. I don't think they are fully occupied. And if there is a possibility to relocate these families within the community.
So the kids stay in school.
So the kids can stay in their school and they can have some sort of stability just in location and where they are and all the places they become familiar with. I think we should try to push, and you know, this is a time where the fact that we do have a lot of shelters in this area helps. There's also, is it Homes for the Homeless is also a family shelter next to the Skyline.
First, yeah.
Right, yeah.
No, 440.
I just want to add one more point to what Katie was saying. And thank you, Katie, honestly, for bringing this to my attention yesterday. The schools were given letters, right, that this was coming down the wire like a few days ago. And so they have been instructed that they can provide each student with a letter stating that, you know, this is their home school and could they hopefully be put in a shelter that is close to their home school. So I really like that idea. They will be provided with that letter. So hopefully that is something that we can do.
So maybe we can do an administrative letter from here, just asking the district manager to convene a meeting with DHS and H&H and DOE in like next week, figure out how the residents of the row can get access to shelter beds here in our district.
I think we need to
Right.
write a letter that indicates that and not have a meeting next week.
I said
because-
administrative letter.
But it's happening every day right now that.
Right. It's currently happening every day.
The letter, administrative letter,
Can go out immediately.
oh, it can.
Yes, that's why I said administrative letter. Second.
Thank you.
Is there the immediate response when ICE comes and takes people? Is there nothing set up?
Wait a minute.
Wait.
I'm sorry, this is very.
We have to vote on a letter though. So vote on a letter. So all those in favor of getting an administrative letter sent on this matter? Okay. Is there any possibility to have a motion to adjourn?
Yes.
Thank you all so much.
Thank you.
Josephine?
You're great. You're welcome.
She's on.
You don't.
Good night.